Good afternoon, everyone. Last week, this week na, we're adding 2 more tests in your schedule. So, वैसे Tuesday, Wednesday you have normal science tech test, but schedule में अभी Thursday, Friday, Saturday tests are not there. But on Friday we'll have a full science test, and on Saturday we'll have a full geography test. While we'll start with art and culture, I know on Thursday we'll be starting with art and culture, है ना? But art and culture का test या environment का test will start from next week. This week you'll have 2 more tests other than what is scheduled. One will be on science tech, other will be on geography, and what will it consist of? The entire syllabus that you have covered. Okay, am I clear about this? है ना? और फिर next week से normal we'll have art and culture test, we'll have 2 art and culture tests, 2 environment tests, and so on. Okay, so we were dealing with health booklet, and I think we had covered viral diseases. Malaria bhi ho gaya tha. Leprosy is something that we had to start with, right? So, leprosy is something that we all have heard of. In Hindi, we call it Kusht Rog. We've heard of Kusht Rog. Now, if you watch old movies, old Hindi movies, Bollywood movies, you will see that people who used to get leprosy, Kusht Rog, they were segregated because there was no treatment available. And once you got it, it's infectious. So if someone else will remain in touch with you, it may lead to spread of the disease. But because it's a bacterial disease, eventually antibacterial or antimicrobial therapies या antibacterial therapies were developed through which it could be treated. तो हमें क्या देखना है? हमें leprosis, it's a bacterial disease caused by what? Caused by Mycobacterium leprae. It's one of the oldest diseases in the world. Like if you look at those things, पुरानी paintings देखोगे तो वहां पे भी there are evidences of this kind of disease happening. What happens in this? So it affects your skin. It affects your mucosal surfaces. Do you understand what mucosal surfaces are? जैसे जो इनर लाइनिंग होती है ना अपने थ्रोट से स्टमक की जो पूरी इनर लाइनिंग होती है दैट इज म्यूकोसल सरफेसेस तो इट अफेक्ट्स दैट it affects peripheral nerves. Do we understand what peripheral nerves are? What are peripheral nerves? देखो एक तो होता है peripheral nerves are एक तो आपका मेन ब्रेन है स्पाइनल कॉर्ड है बट फ्रॉम ब्रेन एंड स्पाइनल कॉर्ड nervous system का rest of the part which is connecting this with rest of the body, no, that is peripheral nerves. So it may affect that also, and it leads to deadening of the skin there, deadening of the head. हम बोलते हैं हाथ सड़ रहे हैं. It leads to that, and if not properly treated, that person whose body is facing this problem, वो अगर कोई physical activity कर रहा है या कहीं if that person gets injured, then permanent damage is also possible. Okay, how many of you have seen some movies which are about Kusht Rog or in which Kusht Rog have been depicted? आप 70s की movies देखोगे ना तो you will be able to see many such instances. Now, it can affect people of all ages. It's not just for elderly or all. Anyone can be get infected by this bacterial disease. It is something which is still a neglected tropical disease. हम पढ़ेंगे आज neglected tropical disease के बारे में. These are the diseases which generally affect people of tropical region जहाँ पे संसाधन or the resources are not that much, and thus on these diseases not a lot of R&D has been done, not a lot of treatment has been developed. So it was one such neglected tropical disease, and 3 countries, India, Indonesia and Brazil, they constitute 81% of the cases, and only India constituting 50% of the cases. Leprosy itna bada problem hai, though we say that we have eliminated that in India. In 2005 we were able to achieve elimination, but we have not been able to eradicate it. World mein there are very few cases, but a lot of it is in India. How does it spread? So it's not actually, exact mechanism is not very well understood, but it is believed that it spreads through contact. There's a possibility that there may be a transmission through respiratory route also, and insects and their bites, like insects when they bite one person and they may bite another person, that may also be a mechanism by which leprosy may be getting transmitted. Ab treatment, as I said, earlier there was treatment was not available, but since it's a bacterial disease, the antibiotic or multi-drug therapy has been developed for this. It is curable, and जब ये curable हो गया, उसके बाद India started this initiative, National Leprosy Eradication Program in 1983. Plan was will be eradicating leprosy, but even today, of the new leprosy cases in the world, most of it occurs where? In India. Though we have not been able to eradicate, but by 2005 we were able to eliminate leprosy from India. Eliminate means we have less than one case for every 10,000 population. And once we were able to achieve this target, the funding for the program, which program? National Leprosy Eradication Program, had reduced, the focus had reduced, and that's why the number of cases which were there in 2005, when we eliminated it, वो number ना kind of stagnant हो गए. They may dip a bit, but then they rise again. They may dip a bit, they may rise again. So leprosy remains a problem, though it's not as common. Not as many people are getting affected. Only 1 out of 10,000 people are getting affected. We have not yet been able to eradicate it. We have been able to do what? We have been able to eliminate it. एक और चीज है, leprosy generally affects people who are from marginalized sections, because वहां पे, because of lack of awareness, sometimes taboo is associated. So in the past, when someone got leprosy, that person was discriminated, was thrown away. So now what happens when someone gets leprosy or even sign of it? They hide it, because they don't want to be discriminated, they don't want to be stigmatized. And generally this happens among people who have lack of awareness, lack of resources, which is the poor section of the society which suffers from it the more. Say for example, tribal population in India is around 7-8%. 18% of the cases in India of leprosy would come from tribal population. This is an indication कि vulnerable people have more of the challenges. So यहाँ पे National Leprosy Eradication Program was started in 1983. So to spread awareness कि भाई leprosy is treatable, don't hide it. There was a Sparsh Leprosy Awareness Campaign, SLEC, that was launched in 2017, and a very important legal change happened through Personal Laws Amendment Act 2019. Now what was this? देखो, earlier when leprosy is not treatable, let's say मेरे को लेप्रोसी हो गया और मैं वो ट्रीटेबल नहीं है, तो our laws allowed divorce. My wife could get separated from me. If I'm suffering from leprosy was a ground for divorce. But now it's treatable. It should no more be the ground for divorce. So personal laws were amended in 2009. On which were the laws amended? The Divorce Act 1869, Dissolution of Marriage Act 1939, Special Marriage Act 1954. ये सारे याद नहीं रखने, बस ये जानना है कि the personal laws which earlier kept it as a ground for divorce, it is no more, because if someone has leprosy, that thing can be treated. Okay, so broadly, do we have an idea of what's happening here? देखो फिर से ना, this is about awareness. We do not have to cram each and every word. लेप्रोसी पे सवाल आया एंड वी आर लाइक कि क्या है पता नहीं, स्टेटमेंट आ गया, इंडिया इज एलिमिनेटेड लेप्रोसी, शुड अंडरस्टैंड यस, एलिमिनेशन का टारगेट हैज बीन अचीव्ड, बट एलिमिनेशन इज नॉट एराडिकेशन. They give you two statements. India has highest number of leprosy cases in the world. India has eliminated leprosy. So someone who has not studied this, who's not aware of what's going on, may say, अरे ये तो conflicting है. Both of them should not be correct, but both of them are actually correct. समझ में आ रहा है? Okay. Just give me a second. Acha, one more thing. What I have done is, like over the last 1 or 2 days, I was updating these notes with more current affairs. है ना, जितना time मिल रहा है, I'm updating this. तो अभी in your notes you may find some highlighted portion which I've added in the last 1 or 2 days. You got these notes on Wednesday only. So in your notes that highlighted portion may not be there, but I'll make sure that in the next booklet, first in the beginning, what I'll have, जो भी यहाँ पे मैं आपको extra notes दूंगा ना, it will be there in your. Tomorrow I'll give you a booklet on computer and IT, and there I will include what? I will include the updates that I have included here, which may not be there in your notes. So in booklet 11 you will have it. Don't worry. जो बच्चे ऑनलाइन भी देख रहे होंगे, परेशान मत होना कि यार ये वाला पोर्शन तो नोट्स में है ही नहीं, सर ने धोखा दे दिया. नहीं, सर ऐसा कोई धोखा नहीं दे रहा. है ना. And after Wednesday I don't have officially classes allocated, but I'll take some classes to finish जो भी छोटी मोटी चीजें रह जाएंगी. I'll keep on finishing it. Your science tech, entire science tech is my responsibility, including current affairs. That's my responsibility. Okay. Now ट्रेकोमा के बारे में आते हैं. ट्रेकोमा ना अभी रिसेंटली न्यूज में था. जैसे आपके नोट्स में मैंने ये वाला पोर्शन हाईलाइट नहीं किया है कि डाउन टू अर्थ में आ रखा था कि सेनेगल हैज बिकम अनदर कंट्री व्हिच हैज डन व्हाट, व्हिच हैज बीन डिक्लेयर्ड ट्रेकोमा फ्री बाय WHO. तो ये I'll just add it in your future notes. But what is ट्रेकोमा? बच्चे इतने लेट क्यों आ रहे हैं? प्लीज जल्दी बैठिए. What is ट्रेकोमा? तो इट्स अ आई डिजीज. इट्स अ बैक्टीरियल आई डिजीज. Which is the bacteria which is responsible for it? So it is Chlamydia trachomatis bacteria. What does it do? So if you look at what happens here in this disease, so when this bacteria infects you, it begins with conjunctivitis, but then a problem occurs. That problem is trichiasis. What is trichiasis? It's your eyelashes, they turning inwards. And as they turn inwards, they scratch on the surface of your eyes. That may lead to permanent blindness. Trachoma is one of the biggest causes of blindness in the world. Though India has, abhi jise hum Senegal ka bol rahe, last year India was also declared trachoma free. Pakistan is also trachoma free. But still, one of the biggest causes of blindness is this disease. समझ में आया? What is happening? Bacteria. Initially conjunctivitis hoga, but because of what is known as trichiasis, what is this? Eyelashes turn inward. This constant irritation and rubbing of the eyelash against the eye can cause corneal scarring and cornea ka scarring and result in visual impairment or blindness. So when you hear trachoma, eye disease, bacterial eye disease, and it is causing problem because of this aspect. Now, bacterial disease, how will it spread? It will spread because if we live in an unhygienic condition. I'm having the disease. I'll not wash my face properly. I'll not wash my hands properly. I'll touch other things. I'll touch other people. They may also get this disease. So, yahan pe, if you'll come here, we have talked about ki it's highly communicable. It can spread through contact of eye, nose, or throat secretion of any infected person. Generally, women are 4 times as likely to get infected due to more frequent contact with infected children. What steps prevented the spread of disease? India mein it has been India has been declared trachoma free. So why? We were able to ensure better treatment with bacterial disease. Antibiotics se treatment possible, unlike viral diseases. Viral disease case mein most of the time what kind of treatment was being given? Symptomatic treatment. Now, यहाँ पे antibacterial antibiotics से treatment है. Sometimes surgeries are also done. Then awareness drive about cleanliness, maintaining hygiene standards, ensuring availability of clean water, and in general initiatives like Swachh Bharat Mission, Jal Jeevan Mission. Jal Jeevan Mission में we want to ensure tapped water supply. These things also will contribute or have contributed to our fight against trachoma. एक WHO का initiative है safe strategy. Safe में S is for surgery for advanced disease. Like trachoma, people who have advanced trachoma, they'll have to go for surgery. Then A is for antibiotics to clear C. trachomatis. Normal, to kill the bacteria, you'll need to do you'll need to take antibiotic. Then F is about facial cleanliness. More you clean yourself, there is less chance that this disease would spread to you or spread to someone else. And then in general hygiene around us, environmental improvements. So the safe strategy किस disease के लिए है? Trachoma के लिए. In fact, देखो जब when I'm talking about this update here, no, कि this country Senegal has been declared trachoma free. When in down to earth this came, they talked about a lot of things about trachoma. वो सारी चीजें मैंने already ऊपर discuss कर ली है. तो they may ask you कि safe strategy WHO का is for which disease? General, मैं फिर से बोल रहा हूं, हमें सब कुछ रटना नहीं है. But once you revise this booklet, you come to safe trachoma, you should understand that. एक और चीज है, India declared itself free of trachoma in 2017 only. But later a lot of surveillance was done, and only after those surveillance WHO was able to declare as trachoma free. हाँ, तो this is about in general trachoma. जैसे यहाँ पे भी हम बोल रहे हैं 1971 blindness due to trachoma was 5%. Today it has come down because of treatment and all. But it is one of the leading causes of. It was one of the leading causes of blindness in 1950s and 60s all over the world, including in India. ट्रकोमा के बारे में जानना है. What kind of disease is this? This is bacterial disease. अब एक ना आपने E. coli बैक्टीरिया के बारे में पढ़ा होगा, है ना? When you get food poisoning, generally E. coli bacteria plays a role. But आपको पता है E. coli bacteria has, like, there are lots of bacteria which are E. coli bacteria, and most of them are good for us, or most of them are harmless for us. In our stomach, a lot of good bacteria, good E. coli bacteria are there, but some of these bacteria can be very problematic. They may release toxins which may cause food poisoning or which may cause digestion issues and other challenges. Okay, so यहाँ पे we have written most of the types of E. coli are harmless, but some strains may cause food poisoning, and food poisoning with associated diarrhea. You may also get pneumonia or urinary tract infection because of E. coli. There are some versions of E. coli bacteria that produce a toxin known as Shiga. One strain 0157H7 can make us very sick. It causes abdominal cramps, vomiting, bloody diarrhea, and is the leading cause of acute kidney failure among children. क्या इसे ट्रीट किया जा सकता है? तो बैक्टीरियल है तो इट कैन बी ट्रीटेड, but in general it is the most common bacteria isolated from patient sample as per the latest report of ICMR's antimicrobial surveillance network. That is, whenever there are chances of food poisoning, there are pretty good chance that which is the bacteria which is causing it, the E. coli bacteria may have caused it. Treatment है, हाँ, antibiotics. Normal bacterial है तो we will be able to treat it using antibiotics, though the problem of antimicrobial resistance may emerge. अच्छा, ये ना थोड़ा रोटा वायरस के बारे में एक और, मैं न्यूज़पेपर्स की जो चीज छूटी हुई है मैं कर रहा था. I'll include this part in your next booklet, जो मैं कंप्यूटर आईटी वाली बुकलेट दूंगा, उसमें I'll add a few paragraph about वो. But do you remember रोटा वायरस वैक्सीन इंडिया के मिशन इंद्रधनुष में दिया जाता है कि नहीं? In to everyone or in a few districts or in a few states? Few districts. रोटा वायरस डायरिया जो होता है उसके लिए the vaccine is given. In 2016, India had introduced one of its indigenous vaccine known as Rotavac to fight against अच्छा, रोटावायरस से डायरिया हो रहा है but it's not bacterial diarrhea, है ना? Sometimes we use the term food poisoning for this also, but because it's viral, the real right term for it is stomach flu. When you're infected by rotavirus, you're having diarrhea, especially kids get affected by it. You're having diarrhea. That diarrhea is caused by stomach flu, and this virus impacts cells that line the small intestine and thus create problems in digestion and other such challenges. ये रोटावायरस कहां पे इंपैक्ट कर रहा है आपको ये समझ में आ रहा है. दूसरा, in 2016 India had introduced Rotavac, a vaccination. This was an indigenous oral rotavirus vaccine and is administered at 6, 10 and 14 weeks of age under universal immunization program. All the vaccines which are included in universal immunization program are provided free of cost by government in government hospitals to children. It was developed as part of public-private partnership. Though it's indigenously developed, but it was developed. Rotavac was developed as part of PPP between Department of Biotechnology, Bharat Biotech. We have heard a lot about Bharat Biotech at the time of COVID vaccination being developed, and then US National Institute of Health and Center for Disease Control and Prevention. देखो, I have not underlined any of this thing. मैं नहीं चाहता कि ना आप इसको एकदम हर बार पढ़ो, हर बार याद करो, बट जनरली ये knowing कि रोटावैक इज अ इंडियन वैक्सीन, वी शुड नो इट बिकॉज अभी रिसेंटली एक और स्टडी आया था अबाउट रोटावैक्स एफिशिएंसी. तो दिस रोटावायरस एंड एसोसिएटेड थिंग्स वर आल्सो डिस्कस्ड इन दोस आर्टिकल. तो स्टडी शोड दैट effectiveness of this vaccine, the indigenous vaccine that we have started using under UIP, is around 54%, and it is similar to 54% efficacy of the virus which was reported in the phase 3 vaccine trial. Means this virus, this vaccine, we have now used it for 8-9 years. is effective as effective as it was found during the normal trials which were happening. And this effectiveness is sustained, or the immunity is sustained for the first 2 years of the life, and it is in this phase of the life that children are affected by rotavirus infection the most, and thus it is able to play a role in reducing those cases and reducing death also. In fact, the proportion of pediatric rotavirus hospitalization has declined substantially since the time it was introduced in the universal immunization program. Though ये viral है, because E. coli was about diarrhea and all, I've just included it here. मैं उसे viral के साथ भी discuss कर सकते थे, कोई issue नहीं है वैसे. समझ में आ रहा है? Rotavirus. And again, please do not try to cram all these things. All this thing is what? Awareness. I mean, मुझे नहीं पता which, because this is also in news. Rotavirus is a very common cause of disease among children. If they ask it, I cannot say ये तो इतना बड़ा HIV नहीं था. Like I was going through PYQs of all the state PCS exams also. पता है आपको 50% of the cases में they are asking about HIV. मैंने बोला उन्हें HIV से इतना प्यार है. I was going through ऐसे उत्तराखंड PCS, इन सब में क्या पूछा है health when it comes to health, and 50% of the time they were asking about HIV. Then they asked about Zika and other stuff also, but most of the time it was about HIV or dengue. वो बहुत popular वाले हैं. But if they ask about rotavirus, we'll not be able to say कि यार ये छोटा है, हमें awareness रखना है. Okay. Now let's come to meningitis. एक और problem which we face, meningitis. Let's talk about this. What is the difference between elimination and eradication? Beta, I've explained that eradication is completely wiped off, no cases. जैसे polio in India has been eradicated, या फिर in world also, which two versions of polio? Type 2 and 3. 2 and 3 has been eradicated. It doesn't even exist in wild. That is our expectation. So that is eradication. But elimination में generally we give a criteria कि if less than one case for every 10,000 population or 1 lakh population in different diseases, we have different criteria for when will we consider a disease to be eliminated. So elimination is not complete eradication. Elimination is drastic reduction. Okay. चलिए अब आते हैं, let's understand the term meningitis. अब meningitis को समझने से लेना पहले let's understand what is meninges. देखो, your brain and spinal cord are covered by this 3 layers which is known as meninges. There is dura matter, there is arachnoid matter, there is pia matter, but वो नहीं, हमें बस इतना समझना है meninges क्या होता है. और meninges में जब inflammation हो रहा, when meninges is facing inflammation, that is meningitis. First of all, did you understand what is meninges and what is meningitis? Now, why this inflammation can be caused? It can be caused by virus, it can be caused by bacteria, it can be caused by toxin, it can be caused by some injury also, some parasite also. Please understand, जैसे acute encephalitis, that was something which impacted our brain. It can happen because of virus, it can happen because of bacteria, it can happen because of other infections or injuries also. When we talk about viral encephalitis, the most common cause in India is Japanese encephalitis. You know, which is the mosquito which spreads Japanese encephalitis? Culex. है ना? Aedes aegypti कौन से disease spread कर रहा था? Dengue, Zika and yellow fever. एक और था chikungunya. It was not of the same family, but mosquito was same, no? Was Aedes mosquito responsible for spread of chikungunya? Okay, let's come back. So meninges क्या है ये समझ में आया? The protective layer over our brain, over our spinal cord. They consist of 3 layers. We do not have to. ये आपको याद नहीं करने हैं, है ना? वो तो just with image this there. But these 3 layers are meninges, and इसमें inflammation is meningitis. It can be bacterial, it can be viral, and you say viral, bacterial, cancer, chemical irritation, fungi, drug allergies, all of them may cause it, and it is the bacterial meningitis which is an extremely serious illness, and several bacteria of Streptococcus pneumoniae, Neisseria, meningitis. There are several bacteria which may be causing it, and this one, meningococcal meningitis caused by Neisseria meningitis, is associated with high fatality rate, especially among small children. It also leads to brain damage. It can spread easily. It has potential of spreading easily as it gets transferred from person to person and may become an epidemic, may become a cause of concern. There can be viral also. Say Haemophilus influenza type B. It was a common cause of meningitis in baby and young children until HIV vaccine was developed. Viral meningitis is more common but generally less serious. It is the bacterial meningitis which creates problems, and generally जो न्यूज में रहता है वही bacterial meningitis रहता है. Fungal meningitis may also be there, parasitic etc. may also be there. Viral and bacterial may spread easily, and general जैसे viral spread होने के लिए coughing, sneezing, all these may lead to spread of viral meningitis. Some of these mechanisms may also lead to spread of bacterial meningitis diseases जो cause of concern हो सकता है. And in last decade it has occurred mostly it has occurred in all regions of the world, but it is most common in 26 countries across sub-Saharan Africa. That is the vulnerable countries, very poor conditions में जो countries है वो. And why it is not affecting others? Because vaccine is available. You will see there are several vaccines which protect you against meningitis, including the bacterial meningitis as well as the viral meningitis. And WHO का भी एक global roadmap to defeat meningitis by 2030 है, where it is primarily focused on in those African countries to improve the situation. Okay, so these are some bacterial diseases that I wanted to cover. मेरे पास और भी बहुत सारे हैं, मतलब जो पिछले एक साल में ज्यादा पॉपुलर रहे हैं. I've tried to cover that पिछले एक दो साल में, but otherwise there are so many other bacterial diseases. We can keep studying that. It will be waste of a lot of time because ROI भी होना चाहिए. Exam में you'll get 1, 2, 3 questions. Best case में you get 3 questions from the health section. And हमें भी उतना ही पढ़ना है. हमें और 100 diseases over the next 5 months, whatever diseases which will keep coming in news, I'll keep doing it. जो भी compilations आएंगे, I'll keep going through them. And if there is anything important missing, I will include it in your notes here. क्योंकि ये वाली वीडियोस तो मैं YouTube पे भी डाल रहा हूं, तो मैंने ऑलरेडी बोला है 23 अप्रैल तक जो भी करंट अफेयर्स रिलेटेड टू साइंस एंड टेक आई विल डू इट. आई विल मेक श्योर कि आपके पास एक सोर्स हो साइंस टेक का, जिससे यू आर कंप्लीटिंग योर एंटायर प्रिपरेशन. ओके, कमिंग बैक टू दिस bacterial diseases समझ में आया. yesterday not yesterday, on Thursday we had done tuberculosis and all, पर उसके बाद आज हमने कुछ important bacterial diseases देखे हैं. Now bacterial या viral diseases से दूर जाते हुए, let us understand what are neglected tropical diseases, NTD. Mahesh is telling a very interesting fact. He says that Dr. Baba Amte, leprosy सबको पता है, महेश सबको पता है ना. तो Dr. Baba Amte personally associated with this founded Anand Van. He founded Anand Van in 1949 in Chandrapur district of Maharashtra and did a lot of work for empowerment of those who were affected by leprosy. This can also be a important thing कि आनंद वन या बाबा आमटे किस बैक्टीरियल डिजीज के अगेंस्ट फाइट कर रहे थे, तो इट वाज लेप्रोसी. आर यू श्योर? सब लोग कंफर्टेबल हैं? ओके, लेट्स नाउ गो टू नेग्लेक्टेड ट्रॉपिकल डिजीजेस. देखो, rather than going into the details, look at the name and try to understand what neglected tropical diseases are. देखो, when we look at the map of the world, around tropical area we don't find very scientifically advanced countries, at least in this phase over the last 200-300 years, when European countries have emerged as the advanced countries, or America and those countries are playing an issue, creating the situation. वेनेजुएला के पास इतने रिसोर्सेस है, ट्रॉपिकल है. मैं मैपिंग में पढ़ाऊंगा, लाइक राइट आफ्टर एनवायरनमेंट आई विल जंप ऑन टू मैपिंग. आपका साइंस के बाद एनवायरनमेंट शुरू हो रहा है, एंड in January only we'll start mapping. That they will discuss Venezuela a lot. है ना? तो ट्रॉपिकल कंट्रीज के पास रिसोर्सेज भी हैं, अफ्रीका में लॉट ऑफ कंट्रीज हैव रिसोर्सेज, बट स्टिल they have somehow been exploited in a way that they are not the scientifically most advanced countries. And if diseases are only affecting them, on those diseases not a lot of R&D happens. Why? अब देखो, when most of the R&D, most of the new medicines are being made in US or in Western Europe, they will prefer those medicines where one, they are getting affected, two, for which people are ready to pay a lot of money. And thus there are some diseases which have been neglected. These are neglected tropical diseases. These diseases continue to create problems in tropical region, including India. इसमें if you look at, अच्छा, these diseases need not be only viral or bacterial, कोई भी हो सकता है. तो you will see the virus से भी हो रहा है, बैक्टीरिया से भी हो रहा है, प्रोटोजोआ से भी हो रहा है, पैरासाइट से भी हो रहा है. What are these neglected tropical diseases? जैसे वैसे तो there is a huge list, but broadly डेंगू, चिकनगुनिया जो हमने पढ़ा है, these are NTD. Leprosy, it's an NTD. Lymphatic filariasis या elephantiasis हमने पढ़ा था, जिसमें बड़े पैर हो जाते हैं, lymph nodes infect होते हैं, तो that is there. Rabies, snake bite, envenoming, trachoma, yaws. These are some of the neglected tropical diseases. एक बार पूरा list read कर लेना, ज्यादा नहीं, हमें पूरा, again we do not have to cram it कि which are the, UPSC is not going to ask you which of the following are neglected tropical diseases, but at least जो diseases हमें बहुत easily याद रह सकते हैं कि यार डेंगू चिकनगुनिया है, ये we should be able to recall. Like while revising also we'll see कि leishmaniasis या काला अजहर, leishmaniasis is काला अजहर, it's also a NTD, it's also a neglected tropical disease. एक और disease है noma. It was the latest addition by WHO in the list of neglected tropical disease. अभी मैं इसके बारे में बहुत डिटेल में नहीं पढ़ा रहा हूं, जैसे in 2024 when I taught it, मैंने पूरे डिजीज के बारे में, because a lot of coverage on that disease was there. अभी बस knowing कि noma is the recent addition in the neglected tropical disease that we should know. Now January 30 को हम वर्ल्ड नेग्लेक्टेड ट्रॉपिकल डे डिजीज ऑब्जर्व करते हैं. इट वाज डिसाइडेड ऑन May 2021, रिसेंटली ओनली. एंड WHO का एक और रोड मैप है 2021 टू 2030, कॉल्स फॉर 3 स्ट्रेटेजिक शिफ्ट टू एंड NTD. उसमें measuring process to measuring impact, like rather than just looking for what are the things that you are doing, what is its impact, focusing on that, from disease specific planning to and programming to collaborative work across sectors, and more importantly externally driven agendas aligned to programs that are country owned and country financed, that is NTD, because Western countries are ignoring it, taking measures at the individual countries level to develop mechanisms to deal with it. But again आपको ये जानना है कि by there's a new roadmap for NTD 2021 to 2030. जब 2021 में ही they have started observing what? They have started observing NTD on 30th January. ये थोड़ा बहुत ध्यान रखो, कभी कभार वो पूछ लेते हैं कि वर्ल्ड एड्स डे कब है, तो ऐसी नेग्लेक्टेड ट्रॉपिकल डिजीज डे हम 30th जनवरी को, कभी कभार, लेस चांसेस आर देयर, बट दे मे आस्क यू, यू शुड नो दैट. तो वी हैव क्लैरिटी ऑन व्हाट एनटीडीज आर. ओके, नाउ लेट्स कम टू रेयर genetic diseases. In fact, just rare diseases. Let's first understand rare diseases and then we'll go to the concept of rare genetic diseases. देखो, rare diseases are those diseases which impact very few people. If I ask dengue impact lakhs of people all over the world. So if tomorrow we develop medicine for dengue, there will be lots of buyers. But let's say एक disease है which impact only 5,000 people a year. A disease which impact only 5,000 people in a year. So a company will not spend billions of dollars to develop medicines or mechanisms to solve this disease, because 5,000 people, even if everyone spend 1 lakh rupees, it's not huge amount, and generally not everyone would be able to spend this kind of money. समझ में आया रेयर डिजीजेस क्या है? बट you'll sometimes study इंडिया में रेयर डिजीजेस का बर्डन इज अराउंड 8 crore. 8 crore people are suffering from rare disease. You say कि सर देखो, there are many rare diseases. तो one rare disease is impacting a few thousand people. But when you combine all these rare diseases, different diseases which will require different treatment, the numbers become very high. बात समझ में आया? अब rare diseases need not be genetic. आप यहां पे देखेंगे, they can be genetic diseases, they can be rare cancers, infectious tropical diseases, and degenerative. There can be tropical diseases which affect only very few people. Right? Sir, what about fungal disease? बेटा मैंने बोला ना, जो भी अगर न्यूज में कुछ है तो I'll do it, otherwise आप ऑलरेडी आर यू नॉट फाइंडिंग हेल्थ में बहुत सारा पढ़ रहे है ना? वही मैं आपको समझा रहा हूं कि एनीथिंग इन न्यूज आई विल कवर इट, बट ना डू नॉट एक्सपेक्ट कि मैं सारे डिजीजेस का लिस्ट बना के आपको याद करवाऊंगा, उसका मतलब नहीं है. यू शुड नॉट वेस्ट टाइम इन डूइंग थिंग्स जिसके एग्जाम में आने की प्रोबेबिलिटी इज नेग्लिजिबल और नॉट देयर. Okay, but if something would be in news, we will do it. We'll for sure do it. अभी मेरे पास ही I have 50 articles left of health, which I want to cover. हाँ, I have it. पूरे साल भर में मैंने जो हेल्थ के आर्टिकल सेग्रीगेट किए हैं, उसमें बहुत सारे हेल्थ के आर्टिकल्स मैं अभी कवर नहीं कर पाया हूं, बट बिकॉज दे आर देयर आई विल कवर इट फॉर यू, है ना? बहुत सारे कोट पप सिगरेट्स पे है, अल्कोहल पे बहुत सारी चीजें हैं, या फिर देयर वर सम अदर डिजीजेस जो न्यूज में थे वो है. तो अगेन इन द लिमिटेड टाइम फ्रेम दैट वी आर एबल टू डू, विल डू दिस, बट एज आई हैव टोल्ड यू कि वी विल टेक केयर ऑफ रेस्ट ऑफ द थिंग्स आल्सो. लेट्स कम बैक टू दिस. पहले हम क्या बोल रहे थे? रेयर डिजीजेस का मतलब समझो. देन रेयर डिजीजेस, दो इंडिविजुअली वन डिजीज विल हैव very few cases, but if we combine all these diseases, number of cases increase drastically. India only may have 7-8 crore cases of rare diseases. They are not necessarily all genetic diseases. They may be some tropical diseases which is impacting only a few people. वो भी rare है ना? Tropical diseases impact only a few people. That can be rare. It can be some rare cancer which impact 1 in 20 million people. Very few people. अब आप, like, if you go to a city in India, a typical city may not have 20 million people. 20 million is 2 crore. बहुत कम cities होंगी. वहां पे एक इन्फेक्ट हो रहा है, तो क्या कोई सप्लायर एक डोज ऑफ मेडिसिन के लिए ये एफर्ट्स कर रहा होगा? नहीं कर रहा. यू विल अंडरस्टैंड व्हाट इज द प्रॉब्लम इन ना. ओके, इंडिया में व्हेन वी लुक एट रेयर जेनेटिक डिजीजेस, रेयर डिजीजेस, मोस्टली इट इज जेनेटिक डिजीजेस. जैसे हेमोफीलिया. डिड वी स्टडी अबाउट हेमोफीलिया? हेमोफीलिया ए बी, फैक्टर 8, फैक्टर 9, है ना? दैट्स अ रेयर जेनेटिक डिजीज. देयर इज thalassemia, sickle cell anemia, and there are some other diseases which may impact us. देखो, these diseases may be impacting around 70 million or around 7-8 crore people in the country, and many of them are children. Okay, now why do we need special focus on rare diseases? We need special focus on rare diseases for many reasons. एक तो है कि generally इसका cost of treatment will be very high, because common treatment has not been developed. Very rare cases में, so even if some treatment has been developed, even if some medicines have been developed, the people who have developed it will sell it at very high prices because there are very few buyers. दूसरा, they are difficult to diagnose. Generally these are genetic disease, and genetic disease को diagnose करने के लिए what will you have to do? Gene mapping and those kind of stuff. So these are difficult to diagnose, and अर्ली स्क्रीनिंग जनरली डजंट हैपन. इंडिया में जैसे अर्ली स्क्रीनिंग के लिए इफ द प्राइमरी हेल्थ सेंटर्स कैन स्क्रीन फॉर द डिजीज, then early screening would be more viable. Most of the people just go to primary health centers, but that scenario is like, we know what is the condition of primary health centers or health and wellness centers in the country, and lack of insurance cover. Currently, there is inadequate insurance cover, and treating practitioners are lacking management practices. And that is why we need special focus on these diseases. 2021 में government came up with national policy for rare diseases, जहां पे they have talked about a lot of things, कि early screening will take place, support will be provided, and a very interesting thing that has happened is here they have also provided for what is known as crowdfunding mechanism. Like sometimes treatment may be as expensive as 50 lakh rupees, 1 crore rupees. So government had said ki we will support, but there's also this crowdfunding mechanism through which people, private sector will be able to support people who are suffering from rare genetic diseases to get treatment. इसी पे ना a few years back Varun Gandhi had written an article. He had said कि कितने लोगों को 50 लाख रुपीस गवर्नमेंट से सपोर्ट मिला है, या how many cases of this crowdfunding through this initiative has happened, and he said कि almost none. People are dying, people are suffering. We have made policy, but the policy is not being implemented properly. तो इस वजह से this issue in general remain in news. But more importantly, जैसे अगर हम आते हैं डिजीज के एग्जांपल्स पे, सिकल सेल एनीमिया, थैलेसीमिया, ये सारे क्या है, रेयर जेनेटिक डिजीजेस हैं, दे रिमेन इन न्यूज. तो in general, do we understand what rare genetic diseases are? We have a policy is not being implemented effectively. वो policy factual है, आप उसे read कर सकते हो, there is no science in it. But which are the most common rare genetic diseases of India? एक है sickle cell anemia. अब देखो, what is sickle cell anemia? Consider this. Everything in your body is made because of some gene in your body. Everything in your body is manufactured because of some gene in your nucleus. If genetic disease है तो gene में there may be some problem. If genetic disease है, gene में भी there may be some problem. So when rather than producing the spherical red blood cells, your body produce this sickle. You understand what sickle is? Sickle shaped red blood cells. In this scenario, what happens? देखो, generally when the red blood cell are spherical, they're able to move easily through the blood vessels. But when they are sickle shaped, they become more sticky, they're not able to move easily. In this case, what would happen? In this case, you are breathing in oxygen. Oxygen is supposed to be taken by red blood cells. Red blood cells में hemoglobin होता है. It is supposed to absorb oxygen from your lungs and then take oxygen to rest of your body, but it's not able to flow. So this anemia is caused by iron deficiency, vitamin B12 deficiency. We had seen that. That was because of nutritional deficiency. Here nutritional deficiency may not be there, but your red blood cells are not able to take oxygen properly to rest of your body. This is what? Sickle cell anemia. क्या do we all understand what sickle cell anemia is? पक्का ऐसे डाउन क्यों लग रहे हो? अनेमिया में आयरन वायरन खा रहे हो कि नहीं? पालक पकौड़े मंगाए जाए. खाने के नाम पे ऐसे भुक्कड़ हो जाते हैं सारे, पढ़ने के नाम पे. सिकल सेल एनीमिया. मरियल लोग. कम बैक. देखो, मैंने पिछले 3 दिन से कोई क्लास नहीं लिया, बहुत बीमार था मैं, पर मैं आपकी क्लास नहीं छोड़ रहा हूँ क्योंकि ऑलरेडी मैं एक क्लास पीछे हो गया हूँ. I should have started computer and IT today, है ना? I have not. मैं Friday, Saturday, Sunday I haven't taken any class. तुम्हारा संडे को ही था. मैं लेना चाह रहा था पर मुझे पता लगा कि सर लेना चाह रहे हैं. मजा आया? चलो. Let's come back. So did we all understand why sickle cell anemia reduces the amount of oxygen reaching your body and can create problems? And why sickle shaped things are being formed? Because gene में there may be some issue, and that's why it's a genetic disease. अब genetic diseases का क्या करोगे? You can keep taking medicines, but your genes are not going to change. Your genes are not going to change. Gene therapy is the only thing that will be permanent long-term solution. Okay. So यहाँ पे we've explained what sickle cell anemia is. Errors in the gene of वो. हाँ, symptoms. Anemia है तो anemia, fatigue, because oxygen is not reaching your body. Will you face fatigue? Episodes of extreme pain called pain crisis, swelling of hands and feet, delayed growth and puberty, vision problems. All these things can be caused by sickle cell anemia. UK ने यूके के ड्रग रेगुलेटर ने in November 2023 they approved a gene therapy known as 𝐂𝐤𝐧𝐬 for the treatment of sickle cell anemia. You will see this is a gene therapy product for the treatment of sickle cell anemia. Idea क्या है? Idea is similar. They'll take out some of your cells from bone marrow. It is from bone marrow where your blood cells are produced. They'll take out some cells. They in lab bring modification in those cells, bring changes in those cells, and they'll put the cell back in your body so that they can multiply more and can produce good red blood cells rather than sickle shaped red blood cells. Gene therapy वैसे because we understand biotechnology, it's easy for us to understand what will we be doing in gene therapy. तो ये डिटेल्स हम पढ़ सकते हैं, बट 𝐂𝐤𝐧𝐬 ये टर्म आता है. तो दिस इज अ जीन थेरेपी फॉर ट्रीटमेंट ऑफ सिकल सेल एनीमिया या ब्लड रिलेटेड डिसऑर्डर्स, ब्लड रिलेटेड जेनेटिक डिसऑर्डर्स. क्या समझ में आ रहा है हमें? ओके. यहाँ पे वी हैव एक्सप्लेन कि व्हाट वुड हैपन एंड हाउ द ट्रीटमेंट अकर्स. नाउ लेट्स गो टू थैलेसीमिया. थैलेसीमिया में ना rather than spherical shell you have these, can you see a different shape? अब this spherical shell, will it be sphere, will it be able to move easily? But this shaped red blood cells will not be able to move easily. ये भी gene disorder की वजह से है. Thalassemia is also a disease which is caused by gene disorder. It's also a genetic blood disorder. So what is it? It is a inherited blood disorder in which body makes an abnormal form of hemoglobin. Now thalassemia के केस में there can be two types of thalassemia, thalassemia major and thalassemia minor. Now if both of your parents are carrying thalassemia related genes, you have a greater chance of inheriting more serious form of the disease. You have a greater chance of inheriting thalassemia major. The disorder results in excessive destruction of red blood cells and eventually anemia. What are the options that you have? Blood transfusion. Blood transfusion में क्या होता है? Every 2-3 weeks you go and get blood transfused. Blood from someone else would be put in your body so that it will have red blood cells. Then bone marrow transplant, though it can be very invasive, but this is also a solution. Medication and supplements and possible surgery to remove spleen or gallbladder may also play a role there. India is considered the thalassemia capital of the world with 40 million carriers. There are these many people who have not thalassemia major, but they have genes. मैंने बोला ना मेजर कब होगा? when both your parents have thalassemia related genes. Like both our parents may be like they are thalassemia minor, they are thalassemia minor. Individually they are not suffering that much, but they come together and दोनों से हमें कौन से जीन मिल गए? दोनों से हमें thalassemia वाले genes मिल गए. We may end up getting thalassemia major, and वहां पे there can be lots of challenges. So while we have 40 million carriers, over 10,000, over 1 lakh patients are thalassemia major. Are we getting it? Thalassemia major, because it is these thalassemia major patients which would require blood transfusion every month. We had a professor at Roorkee. She was suffering from thalassemia, and every 3-4 weeks she will go for blood transfusion. I remember that. उस time मुझे इतना I didn't understand what thalassemia is. We sometimes like चली गई मैडम छुट्टी पे. No, that was our insensitive. अब 20-21 साल में बच्चे कैसे होते हैं? Immature, insensitive, जैसे आप हो. मैं अभी ठीक हुआ हूं. तूने फिर मुझे कुछ दिया ना? Okay. So these are thalassemia major patients who will require blood transfusion regularly. Now, generally what should happen? Thalassemia के treatment के लिए under the 2021 policy support should be given, but most of the treatment and most of the transfusion is occurring where it's taking place in private sector with out of pocket expenses. The 2021 policy and associated benefits haven't been operationalized yet. Baki, to spread awareness about thalassemia and all, May 8 ko thalassemia day is observed, but this is not an initiative by WHO. There is this Thalassemia International Federation which was set up in 1994, which observes this day, and थोड़ा सा इसके बारे में हमें जानना है. बाकी hemophilia A, hemophilia B, have we already done this? Well, when we are talking about gene therapy, we had talked about hemophilia A and hemophilia B. This may excessive bleeding happens. Why does it happen? Because your body is not able to produce proteins which may lead to coagulation. Factor 8, factor 9 की deficiency की वजह से this may happen. One option is आपको factor 8, factor 9 protein extra. It can be given from outside. Other is do gene therapy to ensure that it will be produced. समझ में आ रहा है? Okay. There are a few more diseases that आप न्यूज में सब सुनते रहोगे. एक है डिमेंशिया. Dementia, like sometimes you will see that people in old age will start forgetting things. You know, dementia is not old age specific, but generally with old age, when brain cells are not able to generate themselves as well, they start forgetting things and they start repeating the same thing, or severe, बहुत serious condition होगा, they'll also forget people around them. That is dementia. You may have heard about Alzheimer's disease. Alzheimer's is one form of dementia. The general scenario is what? General scenario is dementia. It is the loss of cognitive functioning, thinking, remembering, reasoning, to such an extent that it interferes with a person's daily life and activities. Though it's more common as people grow old, but it's not a normal part of aging. That is, it's not necessary that every old person will be suffering from it. It's not a normal part of aging. Though most of the cases come there. We have seen recently dementia cases there have been cases of dementia in under 30 people also. There have been a few cases in under 20 also, but वो generally genetic factors की वजह से. But dementia may affect anyone. Now, it is Alzheimer's disease which is responsible for 70% cases of dementia. Dementia may be caused by other factors too, but Alzheimer's is the primary factor for this. According to 2020 report published by Alzheimer's and Related Disorder Society of India, there are 50 lakh people in India living with some or the other form of dementia. क्यों होगा? मैंने बोला आपके न्यूरॉन्स का stop working. Sometimes genetic mutation may also be responsible for it. So in old age, as your neurons stop working, you may suffer because of dementia, and then there can be genetic cases. So generally when young age में, like let's say someone is 28 and starts suffering from Alzheimer's or starts suffering from dementia, most probably the cause is genetic. And in general, in old age people, it is the brain cells not recovering as easily. Now, Alzheimer's ka exact cause is still unknown, why Alzheimer's is caused. But it has been seen that in case of people who are suffering from Alzheimer's, there are two proteins, a beta amyloid and tau. They build up in the body of the person who is suffering from Alzheimer's. So, beta amyloid is usually found in the large quantities outside the neurons or brain cells, and tau tangles are found inside axons, the long slender projection of the neuron. आपने neuron cells के बारे में पढ़ा होगा? You have studied about axon वाला component. So, because it has been seen that these two things are found in large quantities and may be causing problems associated with it, but it's not very well understood, and thus proper treatment have not been developed. Kya there is any prevention mechanism? So there is no prevention as such, but in general it has been seen that people who live a healthy lifestyle, people who are, देखो in general क्या होता है ना, when you are healthy, when you are physically fit, your brain will also be sharper. It will be able to have longer life, and as it will be able to have longer life, chance of dementia will be lesser or chance of Alzheimer's disease would be lesser. पर अभी ना जैसे dementia generally होता है old age लोगों में. In 2023 एक न्यूज आया था कि a 19-year-old from China have seen Alzheimer, have been detected with Alzheimer's disease. This is the youngest person detected with Alzheimer's disease. Before this, under 30 cases have happened, but most of those under 30 cases was because of faulty genes. But yahan pe in this particular case, faulty gene has been ruled out. That is, without faulty genes, Alzheimer ka in people as young as 19 years of age, Alzheimer cases have been found. So this can be a cause of concern. फिर in January 2023 लीकानेमैब, अब ये ना मैं रिसेंटली जब आप अभी भी आप अल्जाइमर्स के बारे में गूगल करोगे, दे विल टॉक अबाउट दिस ट्रीटमेंट. This is a medicine which has gained FDA approval for early Alzheimer's disease. This is a treatment that may moderately slow mild cognitive decline and reduce amyloid B plaques. It is amyloid B which gets collected more in the body, which it has been seen that Alzheimer's ke case mein it gets collected more in the body, and this medicine will be able to reduce it, and thus in early Alzheimer's it can play a role in controlling it and reducing it. So this lecanemab term थोड़ा सा ध्यान रखो. Over the next 5 months you may see this term 5 times and थोड़ा ध्यान में रह जाएगा. When you'll have it in option, you'll be able to हाँ ये this was I have heard something like this. ऐसे ही रटना नहीं है बैठ के, but थोड़ा, because it is in bold, every time you'll go through this booklet you will go through this term. हमें समझ में आ रहा है? Okay. Now let's talk about mitochondrial disease. क्या आपने mitochondrial diseases पढ़ लिया है? बायोलॉजी बेसिक्स में पढ़ लिया था? पढ़ लिया था? नाइस. तो कैन आई स्किप दिस? पक्का? ओके, ग्रेट. थ्री पेरेंट बेबी वाला कॉन्सेप्ट टू ट्रीट माइटोकॉन्ड्रियल डिजीज. थ्री पेरेंट बेबी नहीं पढ़ा? शिफ्ट का तुम टेस्ट वेस्ट के लिए पढ़ रहे हो कि नहीं? यू शुड नो मोर देन अ टीचर. वाई? प्लीज समझो. मैंने आज ये पढ़ा दिया, उसके बाद आई एम नॉट सपोज टू रिवाइज इट. यू आर सपोज टू गो होम, रिवाइज इट. यू आर अगेन सपोज टू रिवाइज इट फॉर दैट फुल टेस्ट. तो यू हैव टू बी मोर अवेयर देन व्हाट आई एम. मैं इसे पढ़ा दूंगा, फिर मैं भूल जाऊंगा. I'll only read it again when in newspaper something comes. I'll come back to these notes, I'll add something, I'll remove something. But you are supposed to revise it regularly till preliminary examination. You should be able to laugh at me in May कि सर आपको आप भूल गए आप. You should be like that. है ना? तो ये कंफ्यूजन होना नहीं चाहिए. पढ़ाया नहीं पढ़ा, हाँ आता है, रिवाइज किया है. नहीं पढ़ाया तो सर नहीं पढ़ाया. I'm sure, I'm 100% sure. Okay. Let's come to non-communicable disease. अब डायबिटीज और कैंसर और अल्कोहल और सिगरेट्स, इन सब से जो डिजीजेस हो रहे हैं, लेट्स talk about that. Abhi tak we dealt with viral diseases, bacterial diseases, then we went into genetic diseases, mitochondrial diseases we have talked about. Let's talk about non-communicable diseases. देखो, these diseases are not spread. जैसे एक vector आया, suppose I have diabetes, mosquito comes and bites me and goes and bites you. You're not going to get diabetes. You may have got dengue, you may have got malaria. Or when I'm coughing and sneezing and I have some viral infection, you may get that. All those diseases were communicable diseases. But when it comes to something like cardiovascular diseases, जहाँ पे like you get a heart attack, or no, you don't get a heart attack. When someone gets a heart attack or brain stroke, it basically is flow of blood to heart has been stopped. It may be because of blocking of the arteries. It may be because of other factors, of flow of blood to the brain has been reduced or stopped. That may lead to brain stroke. These are non-communicable diseases. या फिर cancers, chronic respiratory diseases like chronic obstructive pulmonary disease and asthma, diabetes. These are non-communicable diseases. Earlier it was thought that mostly elderlies in urban areas who do not have a lot of physical movement suffer from it, but now it is well understood that everyone may suffer from it. Any age group may people may suffer from it, and we all have to lead a very healthy lifestyle in order to keep ourselves protected. Delhi में तो पता ही नहीं कैसे healthy lifestyle जिएंगे. We're all smoking every day. 45 सिगरेट्स, 22। गवर्नमेंट इसलिए सिगरेट के प्राइसेस बढ़ा रही है। जस्ट वो, बट ऑल दीज थिंग्स मे बी रिस्पॉन्सिबल फॉर नॉन कम्युनिकेबल डिजीजेस। अब थोड़ा सा एक एक करके शुरू करते हैं। सबसे पहले द टर्म ओबेसिटी। ओबेसिटी इज एसोसिएटेड विद अ लॉट ऑफ डिजीजेस। अब ना इन 2025 इंडिया में डेफिनेशन ऑफ ओबेसिटी हैज चेंज्ड अ बिट। अच्छा, बिफोर वी गो देयर, डू वी नो व्हाट इज बीएमआई? व्हाट इज बॉडी मास इंडेक्स? हाँ, वो तो फुल फॉर्म नहीं, वेट डिवाइडेड बाय हाइट, हाइट इन मीटर स्क्वायर। श्योर, हाइट को भी क्यूब, हाइट का भी स्क्वायर करना पड़ेगा। जैसे ऐसे समझो, सपोज someone's weight is 100 kg and height is let's say 1.7 meters। 173 सेंटीमीटर कितना होगा? 1.7 मीटर। तो इफ यू जस्ट डू दिस, बीएमआई कितना आ जाएगा? इट विल मोर देन 50 ना, बट दिस इज नॉट। तो यू, बीएमआई इज वेट डिवाइडेड बाय हाइट का स्क्वायर, हाइट इन मीटर उसका स्क्वायर, देन यू गेट बीएमआई, है ना। व्हाट इज द स्क्वायर ऑफ 1.7? 2.89। 1.7 का स्क्वायर है 2.89 ना, तो 100 ओवर 2.89, इट विल कम 35 36 कुछ, है ना, और ज्यादा आएगा, 35 36 आएगा। दिस इज हाउ यू मेजर बीएमआई। तो अर्लियर व्हेन वी टॉक्ड अबाउट ओबेसिटी, बीएमआई वाज द ओनली क्राइटेरिया दैट वाज यूज्ड, एंड द क्राइटेरिया वाज डेवलप्ड बाय वेस्टर्न कंट्री। तो उनकी बॉडी के हिसाब से दे डेवलप्ड अ बीएमआई बेस्ड क्राइटेरिया कि जैसे थैंक यू। हाँ, earlier only BMI based criteria was there. जैसे if you'll go to BMI over 30 Western standard में, if you are going to BMI over 30 you are having obesity। तो जिस पर्सन का हमने 100 kg by 1.73 meters का वो लिखा था, that it was, this person was suffering from obesity, and a person whose BMI is more than 25 kg per meter square, that person is overweight। तो आप सब लोग आज जाके अपना BMI कैलकुलेट कर, सब ओबीज है। ओवर वेट इज 86। तुम सबको अपने सारे फिगर्स भी बता दो, है ना, माई वेस्ट इज दिस एंड और बाकी सब बाइसेप्स चेस्ट सब बताओ, 16 का डोला। चलिए लेट्स कम बैक। तो वेस्टर्न स्टैंडर्ड्स में ये मैकेनिज्म यूज होता था, कौन सा, कि यार इफ योर BMI is above 30 then you are obese, and if your BMI is above 25 you are overweight। But India में these standards have been made more strict। जैसे अभी some researchers decided कि इंडिया में the criteria of overweight should be from 23 to 24.9 and criteria for obesity should be more than 25। तो इंडिया में इन इंडियन बॉडी टाइप, बिकॉज इंडियन बॉडी टाइप में ना फैट ज्यादा होता है और मसल मास कम होता है। इंडियन बॉडी टाइप में फैट ज्यादा होता है, तो यू शुड नॉट हैव अ लॉट ऑफ फैट, एंड दैट इज व्हाई इवन अबाउट 25, तो जितने लोग अभी तक अपने आप को 20 नहीं समझ रहे थे कि मेरा बीएमआई तो सिर्फ सिर्फ कितना है, 26 है, आई मे बी स्लाइटली ओवरवेट बट नॉट obese। As we go, as per these recommendation by these researchers, we will be obese, but they say कि यार this is not all, like it should not be the only thing। now ऐसे मानो कि if we take धनंजय's case, धनंजय का वेट इतना ही रहता है, बट सपोज ही डज अ प्रॉपर फिजिकल एक्टिविटी एंड फैट रिड्यूस हो जाता है, मसल मास बढ़ता है, हिज वेट में रिमेन एज इट इज। जैसे धनंजय ने अपनी प्रिवेसी को ध्यान में, प्रिवेसी को इग्नोर करते हुए हम सबको बताया कि ही इज 96, अच्छा 86, है ना? तो ही इज 86 एंड 1.69 मीटर, है ना? ये करोगे तो आपको आएगा कि हाँ ये तो अभी ओबीस है. बट इफ धनंजय रिमेन्स 86 बट अपना फैट ड्रास्टिकली रिड्यूस कर ले और मसल मास बढ़ा ले, his BMI will still come this, but he would not be obese. So they said कि BMI should not be the only criteria. This added कि यार BMI alone may lead to misdiagnosis and it should be integrated with presence of other comorbidities. कि with this much BMI, how, like, are you suffering from, are you having high sugar or are you having other challenges based on that? Otherwise, high BMI may also be better if it's mostly muscle mass. ऐसे एक और चीज हुआ कि when we talk about ideal waistline, so in case of India, it has been kept as more than 90. It has to be 90 centimeter for men and 80 centimeter for women, and for western countries it is 102 centimeter and 88 centimeter. तो उनका criteria is not going to fit on us. Their body type is different from our body type. This is what they have been talking about. तो वैसे in general obesity is overweight होना कैसे measure करते हैं हम? BMI से measure करते हैं, but researchers are supporting that India में BMI above 25 only should be considered obese, and BMI above 23 should be considered overweight rather than above 25 and above 30. Okay. Now let's talk about hypertension, blood pressure. आप ये हाई बीपी, लो बीपी वाली प्रॉब्लम्स सुनते होंगे. देखो, what is blood pressure? You know, blood flows through arteries. Arteries में कौन सा blood जाता है? From your lungs, blood is taken to rest of your body through arteries. Oxygen rich blood. The blood reaches your lungs, it gives out CO2, it absorbs oxygen, and oxygen rich blood flows through arteries. As the blood is flowing through arteries को ऐसे pipe समझो. As the blood flows through the pipe, will it apply some pressure on the wall of the pipe? That pressure is blood pressure. And if that pressure is very high, it can be a cause of concern. Too much pressure on your arteries can be a problem. It may also indicate, high BP may also indicate, देखो कई बार same amount of water you have to transport and pipe is much smaller. Will water be applying more pressure on it? So as your blood vessels get clogged, it may lead to more pressure. It's a high BP is an indication that there are health issues that you are facing. Okay, so what is blood pressure? Do we understand? हम जो blood pressure measure करते हैं doctors, if your blood pressure 140/90 है, then you are considered to be suffering from hypertension, and it's a serious medical condition. A large number of people who suffer from hypertension are unaware of this, and therefore it is also sometimes known as silent killer. They don't know that they're suffering from hypertension. They keep living like that. In general क्या होता था ना, we used to say कि BP, sugar ये अमीरों की बीमारी है, and thus most of the people in rural India never even got themselves tested. या फिर most of the people who are thin, who are not rich, they didn't get themselves tested, but they forget the fact कि डालडा ही खा रहे हो. Everyone, like, things have changed. People were consuming a lot of hydrogenated fat. They considered it tastier and all, but it wasn't good. You cannot compare current scenario with the scenario of 100 years back. 100 years back, आपके गांव में खेतों में जो तेल, सरसों का तेल निकल रहा है, वो निकल रहा है, आप वो कंज्यूम कर रहे थे. But now things have drastically changed. Our food pattern have changed. Processed food is in play a lot. If you'll remember when you were kids, आप ना शायद एक महीने में एक बार ऐसे मैकडी में जाके बर्गर खाओगे कि इट वाज अ ट्रीट, है ना, कभी वैसा. बट नाउअडेज कहीं पे भी बर्गर खा लेते हैं. वो तो our food habits have changed, everything has changed, and BP is something which is impacting everyone. Everyone in the sense which can young, old, fit, unfit, anyone may be suffering from BP. Now, it can't be cured, but can be managed through lifestyle changes, food habit changes. As per WHO, hypertension affects 1 in 3 adults worldwide and 33% of them are unaware of it. So, जैसे 33% of the adults in the world are suffering from BP or blood pressure and 1/3 of them are not even aware of what's happening. India may be, as per National Family Health Survey 5, we started health wala booklet with NFHS 5. As per National Family Health Survey 5, the hypertension prevalence in male is 24%. तो 4 में से 1% has high BP, 21% in women, and it is an increase from National Family Health Survey 4. National Family Health Survey 4 2015-16 में हुआ था. Within 5 years, you can see how much increase in the BP situation has occurred. So how do we generally deal with it? एक तो first is awareness. We have to know कि we are suffering from BP. Our blood is putting a lot of pressure on our arteries, and then lifestyle changes. Eating healthy diet, quitting tobacco, quitting alcohol, more physical activity, reducing salt intake. कल से आप सब लोग stairs use करना शुरू करो. ऑलरेडी कर रहे हो है? मैंने कोट ही ऐसा लिख दिया. क्या कोट लिखा है? Success does not take. What does it take? These small things. जैसे ना, I see a lot of people. They come by metro, but metro से यहाँ तक रिक्शा लेते हैं. ऐसा ORN से आ रहे हैं, यहाँ तक रिक्शा लेके आते हैं. ये लड़कियों में ज्यादा है. इतनी धूल में कौन वॉक करेगा? नहीं, I also see my colleagues working here. In the evening, if they want to go to the metro, they'll take a rickshaw. कि हाँ? Develop. They'll take rickshaw at the beginning of the month. सब लोग सेलेक्ट हो जाओ. कोचिंगों के चक्कर में मत पड़ना, बहुत दुखी रहोगे. Okay, come back. What were we talking about? कि some basic changes in our lifestyle can have impact. Though it will not have drastic impact. अगर BP ज्यादा है तो आपको actually डॉक्टर से कंसल्ट करके. और पता है कई बार ना, जैसे one of my friends recently got diabetes. He was only 33-34 और डायबिटीज में भी एकदम हायर लेवल वाला. एंड ही विजिटेड अ डॉक्टर. डॉक्टर ने बोला नहीं, तुम्हें मेडिसिन लेना ही पड़ेगा. ही वाज थोड़ा एडमेंट. ही मेट अ डाइटिशियन एंड डाइटिशियन सजेस्टेड सम चेंजेस कि आपको सुबह ये खाना है, आपको रोटी चावल बंद करना है, यू विल हैव इनफ कार्ब, यू विल हैव इनफ प्रोटीन. एंड ही फॉलोड इट. ही सिंसियरली फॉलोड इट. एंड in 5 months he was able to reverse it. And he tells me कि यार अब मुझे ना, आई वॉन्ट टू गो टू दैट डॉक्टर जो बोल रहा था कि नहीं मुझे मेडिसिन लेना ही पड़ेगा. तो देयर इज लाइफस्टाइल चेंजेस से व्हाट कैन हैपन. लाइफस्टाइल चेंजेस से improvement in diabetes या improvement in blood pressure like scenarios may happen, but you have to be very disciplined. This person who loved naan and butter chicken left it altogether, is eating tandoori fish with बेसन का चीला. मतलब समझ रहे हो ना, वो अपने हैबिट्स को चेंज कर रहे हैं कैसे कि हेल्दी चीजें कंज्यूम करेंगे, नॉट अनहेल्दी थिंग्स. ओके, लेट्स कम टू सॉल्ट इनटेक एंड इशू ऑफ सॉल्ट इनटेक एंड बीपी. अब देखो, प्लीज अंडरस्टैंड, योर blood is supposed to have some minerals, some salt in it. But if the salt's concentration is higher in the blood will try to absorb more water so that salt का concentration कैसा रहे. But as that pipe gets more water, will there be more pressure? तो समझ में आ रहा है why high salt intake may lead to BP? How high salt intake may lead to BP? I'm saying this कि this is, let's say, are pipe through which the blood is flowing. Arteries through which blood flow, but by simplification के लिए pipe through which blood is flowing. But if in it concentration of salt increases, our body will try to absorb more water so that salt becomes diluted. As it absorbs more water, there is more water flowing through our blood vessels, and as more water is flowing through our blood vessels, will there be more pressure? तो कैसे salt is leading to high BP? How salt is leading to high BP? Do we understand this? पक्का? तो adding less salt to food, fewer heart attacks and strokes. Simple. Reduce salt consumption. And पता है जो homemade food होता है ना, we actually don't consume a lot of salt in it. आपके दाल में थोड़ा भी salt ज्यादा हो जाता है, you are not able to eat it. It's generally when you're eating food outside, you'll try to make it like tasty, वो मसाला extra होगा, उसमें salt extra होगा, and there we end up consuming a lot of salt, which leads to high BP wala issue, and high BP may lead to heart attacks and strokes and all those issues. Even people who are participating in DASH diet, that is dietary approaches to stop hypertension, even in their cases it has been seen what कि high BP may occur because of high salt intake. कुछ और चीजें हैं. Sodium intake from processed and restaurant food contributes to high rates of high blood pressure, heart attack and stroke. Reducing sodium intake could prevent thousands of deaths annually. Sodium chloride के फॉर्म में आप salt लेते हो. Reducing that can reduce blood pressure and can save thousands of lives. Just reducing. और देखो यहाँ पे भी notice something. Processed and restaurant food की बात कर रहे हैं. Generally, मैं फिर से ना, in our home where we are making good food, we will not have excess salt in it. Salt कई बार बहुत कम डाला जाता है कि जिसको ज्यादा चाहिए वो अपने आप ऐड करेगा. But in restaurant, there will be so much of masala, you will not realize that there's a lot of salt. WHO in 2025 gave guidelines on low sodium salt substitute. It said that excess sodium has become an issue and sodium salt can be replaced by potassium salts in some cases. यहाँ पे low sodium salt supplements में they're saying कि WHO recommends reducing sodium intake to less than 2 grams per day. And if you are consuming more salt, you may add other forms of salt like potassium and all. But excess potassium may also create problem. Too high potassium is also bad. It may lead to kidney related disorders. So there has to be a balance there also. ये समझ में आ रहा है कि how high blood, देखो अभी हम शुगर पे जाएंगे. High sugar में will lead to what? Will lead to diabetes. आप बोलो जीने ही मत दो हमें. मीठा नहीं खाने दो, salt नहीं खाने दो. क्या खाएं? फाइबर. खीरा खाओ कच्चा बिना बहुत सारा मसाला डाले हुए. That's a good food that will fill you up, and then उसके बाद आप useless चीजें कम खाओगे. और बातें करते हैं. Let's come to ये hypertension is understood. देखो again, rather than just thinking कि मैं इसे याद कर लूंगा, please try to connect the dots. Please try to when you go home today and read it. अच्छा कल आपके टेस्ट में हेल्थ ही आ रहा है. कल जो आपका टेस्ट होगा, what is the syllabus for test? Health, the entire health booklet. The entire health booklet 1, 2. We have given 2 booklets on health. That is part of your test tomorrow. अच्छे से revise करो. While you are revising it, observe these things. And when people around you talk about hypertension, talk about blood pressure, उससे connect करो. Ideally, we should not need to teach this in classes. हमारे अराउंड इतने केसेस हो रहे हैं. इंक्विजिटिव माइंड शुड हैव इटसेल्फ नोन इट. आप में से बहुत सारे लोगों को पता भी होगा ये सारी चीजें, बट एक बार जिनको जैसे भी जो भी लूप होल्स है, लेट्स फिनिश इट. लेट्स बी रेडी फॉर दीज टॉपिक्स. ओके, नाउ लेट्स गो टू डायबिटीज. डायबिटीज क्या है? ब्लड में शुगर लेवल remaining high. If in your blood sugar levels remain high, that's the situation of diabetes. Now, diabetes can be of 2 types, type 1 and type 2. Type 1 diabetes generally bachpan is detected in the early childhood only, and it is caused when your body is not producing enough insulin. Which organ of your body produces insulin? Pancreas. Pancreas mein there are beta cells, they produce insulin, but if there are malfunctioning beta cells or there are some autoimmune challenges, it may lead to your body not being able to produce enough insulin. And insulin is a hormone which regulates what? Sugar in your blood. If your body is not able to produce enough insulin, sugar in your blood is not regulated. It may spike, it may go very high and may create problems. पहला टाइप 1 डायबिटीज. क्या हम सब टाइप 1 डायबिटीज को समझ पा रहे हैं? अब टाइप 2 डायबिटीज occurs. अब टाइप 2 डायबिटीज को ना थोड़ा सा वैसे समझो कि जनरली व्हेन यू सी दैट समवन इन ओल्ड एज is getting diabetes, or someone like hamari age maybe, if someone is suffering, I was talking about a friend who got diabetes recently. If that friend got diabetes, what kind of diabetes did he get? Type 2. Now you will say, sir, type 2 diabetes, but his body is producing enough insulin, no? Why did he get type 2 diabetes? That friend of mine, why did that person get type 2 diabetes? If the body is functioning properly, insulin is being produced. Please understand. See, एक तो you're consuming too much sugar and your insulin production is not able to manage it. But more importantly, ऐसे समझो कि suppose there is insulin, you're consuming food to manage the sugar level, insulin is released, but even after insulin is released, your body sees कि यार sugar level remains very high because you're consuming that much of sugar. Processed carb and everything, food with high glycemic index. Abhi we'll talk about what glycemic index is, don't worry. So eventually over the period क्या होता है ना, your body realizes, okay, this production of insulin is not leading to reduction of sugar. It remains very high, and thus your body slowly becomes insensitive. They may start producing lesser insulin, and as they start producing lesser, as the body starts producing lesser insulin, regulation drastically suffers, and फिर insulin has to be given from outside. You may have seen people taking insulin injections. So excess consumption of sugar, regular consumption, which makes your body eventually feel कि we are not able to regulate it. What is the point of producing insulin? Insulin production reduces. That causes type 2 diabetes. Are we able to differentiate between type 1 and type 2 diabetes? Type 1 diabetes, आपकी बॉडी इंसुलिन प्रोड्यूस ही नहीं कर पा रही है. Type 2 diabetes, your body was producing insulin, but later it became insensitive, and the insulin production may have stopped. If gym body means weight increase, how would we consider overweight or fit if BMI is 26? अब बेटा fat percentage देख सकते हो ना कि in your body how much of fat is there, that can be a criteria. अभी we'll talk about insulin injection कैसे लेते हैं, क्यों oral injection नहीं ले रहे, क्यों blood में ले रहे, we'll talk about that. But are we able to differentiate between type 1 and type 2 diabetes? अब देखो type 1 diabetes का scenario समझो. इंसुलिन 1920s में डिस्कवर हुआ, but before that there was no insulin. मतलब our body used to produce insulin, but there was no insulin being manufactured or extracted from some animals. So a person who is born in, let's say, 1850, 1852 में डॉक्टर realizes कि इसकी बॉडी इनफ इंसुलिन प्रोड्यूस नहीं कर रही है, dies. No matter आप क्वीन एलिजाबेथ के नहीं, वो क्वीन विक्टोरिया के बच्चे हो, उस टाइम विल हैव टू टॉक अबाउट क्वीन विक्टोरिया, और आप नेपोलियन के हो या किसी और महान बड़े अमीर या आप बहादुर शाह जफर वाले हो, मुगल एम्परर ऑफ इंडिया टिल 1857, है ना? व्हाट हैपेंस? यू डाई. Type 1 diabetes people used to die. 1 or 2 years, 3 years, they used to die because there was no treatment available. Now we have insulin. In fact, there's a so what is insulin? Insulin is a hormone that is produced by beta cell of our pancreas. In the beta cells, insulin is produced as a big molecule known as pro-insulin. हमने देखा था A, B, C 3 proteins थे which were connected by the bonds, है ना? वो तो it is produced as pro-insulin. Pro-insulin is broken into two pieces, insulin and C peptide separately. Now देखो insulin ना यहाँ पे देखोगे it's a peptide hormone. Peptide hormone basically means ये प्रोटीन है. Peptide hormone basically means it's protein made up of amino acids. Now, if we take insulin pills and put it in our body, in our stomach, as amino acids go, it will break it and digest it. It will not reach our blood, and that is why insulin is not taken orally. A lot of people are suffering from diabetes. Injecting them every day doesn't seem nice, but that is what needs to happen because insulin has to be introduced directly in the blood, because if it goes in your stomach will end up digesting it. Okay, now ये 1921 में इंसुलिन को डिस्कवर किया था सर फ्रेडरिक जी बैंटिंग ने, एंड इनको ही नोबेल प्राइज मिला था फॉर दिस डिस्कवरी. बट even today a lot of people are suffering from type 1 diabetes and they're dying also, but it's mostly about health facilities, accessibility of medicines and those stuff. In type 1 diabetes is death due to type 1 diabetes is completely preventable. When someone is dying because of type 1 diabetes, India maybe when children are dying because of type 1 diabetes, it simply means our health infrastructure isn't good enough to take care of people. Simply it means that, because this is preventable diseases. Type 1 diabetes should not be a problem. Now, type 2 diabetes, we understand type 2 diabetes also. इसमें आप पढ़ोगे कि type 2 diabetes is caused by when we consume food with high glycemic index, excessive food with high glycemic index. तो what is glycemic index? एक और टर्म जो आप रेगुलरली हेल्थ के पर्सपेक्टिव से सुनते रहोगे. तो glycemic index is the property of food which is associated with how much blood glucose will it increase. A food, if it increases more blood glucose, it has high glycemic index. If a food increases blood glucose less, it has low glycemic index. If a food doesn't have any sugar, any glucose, उसका glycemic index 0 रहेगा. For example, when someone eats meat, मीट में फैट है, प्रोटीन है, कार्ब्स नहीं है, तो मीट का ग्लाइसेमिक इंडेक्स क्या रहेगा? 0. Do you understand what glycemic index is? Look at these examples. लो ग्लाइसेमिक इंडेक्स वाले फूड क्या है? जहां पे ग्लाइसेमिक इंडेक्स इज लेस देन 55. फ्रूट्स लाइक एप्पल्स, स्ट्रॉबेरीज, डेट्स, ऑरेंजेस, बनाना, ब्लूबेरीज. वेजिटेबल्स, कैरेट्स, ग्रेन्स, लेग्यूम्स. Dairy products and alternatives, soy milk, skim milk, whole milk, sweeteners like fructose or coconut sugar, they are considered to have low glycemic index. But यहाँ पे आप fruits देखो, यहाँ भी fruits थे, but if you look at pineapple has medium glycemic index. और vegetables में there we had low glycemic index में certain vegetables, carrots, boiled carrots and all. Here this sweet potato, you know it will be having more carbs. Or grains, popcorn, brown rice, sweeteners, honey, table sugar, these may have medium glycemic index. And then high glycemic index wale food, white bread, whole wheat bread, white rice. अब देखो whole wheat bread करके आपको बेच दिया जाता है bread को, it still has high glycemic index. Starchy vegetables like potatoes, french fries, baked goods, cake, donut, chocolate, क्रैकर्स, माइक्रोवेव पॉपकॉर्न। पॉपकॉर्न हमें खिलाया जाता है ना कि ये इसमें तो क्या ही है, ये तो हल्का सा है। That's a food with high glycemic index. Chips, sugar sweetened beverages, soda, fruit juices, sports drinks, all these things have high glycemic index. अब ना देखो, I'm not underlining any of these things because I again do not want you to cram these things. But क्या ना general awareness रखना है. When you'll do this, when you'll read glycemic index में these examples also, you'll understand glycemic index का meaning more. What is it? It's not जो sweet taste में sweet कर रहा हूं. Like white bread may not taste sweet. Banana may taste sweet, but banana still has lower glycemic index when compared to bread. So when someone is facing what? Diabetes, insulin resistance, हमें कौन सा फूड देना है? लो ग्लाइसेमिक इंडेक्स का. मैंगो बताओ कहां जाएगा? हाई. It has lots of sugar. तो people who have diabetes उनको मैंगो जनरली मना किया जाता है. मैंगो मतलब पका हुआ मैंगो. It's rich in sugar. Okay, now food which is high in refined carbs and sugar, they are digested more quickly and thus will have high glycemic index. तो जैसे wheat bread है. Wheat bread may not appear sweet to us, but it is digested by our stomach easily. As it is digested easily, उसका जो sugar है, it goes in our blood easily and thus its glycemic index is high. Whereas food which is rich in protein, fat or fiber, they typically have low GI. There are some food which does not have any carb. उनको GI assign ही नहीं होता है. For example, meat. Meat may not be assigned GI. या nuts, जैसे यहाँ पे देखोगे meat, fish, poultry, nuts, seeds, herbs, spices, oils. Oil तो पूरा fat है. They don't contain carb, so they may not be assigned any glycemic index. Only that food which has carbohydrate in it is given glycemic index. Do we all get? Okay. Now, advantage of low glycemic low glycemic diet. Simple CJ, blood sugar regulation. Make sense? Weight loss. More sugar leads to your body not being able to burn any fat. As you consume less sugar, less carb, your body starts burning the stored fat. Then could benefit people with fatty liver. Low glycemic food could reduce liver fat and liver enzyme levels in people with non-alcoholic fatty liver diseases. तो fatty liver diseases से भी deal करने के लिए what are we supposed to do? We are supposed to consume food which are of low glycemic index. अच्छा, अब एक और चीज समझते हैं. देखो, there are two people. One is eating let's say strawberries. Strawberries को अपन ने low glycemic index में डाला है. And other one is eating bread. Which has low glycemic index? Strawberry. But ना वो स्ट्रॉबेरी खाने वाला आदमी 1 किलो स्ट्रॉबेरी खा जाए, धनंजय जैसा निकला. तुम मजाक मत उड़ाओ. 86 है बेचारे का, तुम 96 बना रहे हो. तुम क्यों बता रहे हो? तो पता है सचिन तेंदुलकर का भी देश में मजाक उड़ता था. जब तक भाई खेल रहा होता था कि ये तो आउट हो जाएगा, ये तो अपने लिए खेलता है, तो मत बताओ. मोर यू विल बी इन पब्लिक, मोर पीपल विल बी सेइंग बैड थिंग्स अबाउट यू. तो नेवर गो मेरा वेट ये है, मेरा हार्ट ये है, मेरा दिल. डोंट डू दैट. ओके, लेट्स कम बैक. तो वैसे तो स्ट्रॉबेरीज हैव लो ग्लाइसेमिक इंडेक्स, बट समवन हु कंज्यूम्स अ लॉट ऑफ स्ट्रॉबेरी, ये पर्सन आता है, ये सुबह 2 ब्रेड खाएगा, 2 बॉइल्ड एग खा लेगा, बोलेगा मेरा ब्रेकफास्ट हो गया. ही वुड से तेरा खाना हाई ग्लाइसेमिक इंडेक्स वाला है. आई एम ईटिंग लो ग्लाइसेमिक इंडेक्स स्ट्रॉबेरी, but he consumes lots of strawberry. Who will have more chances of getting diabetes? This person. So this is measured by glycemic load. क्या ग्लाइसेमिक इंडेक्स कम हो, बट if you are consuming a lot of it, your glycemic load, तो your food, your diet will have high glycemic load. तो glycemic index और load में difference समझ में आया यहाँ पे? That is what is we are talking about. The glycemic load, it takes into account the amount of food eaten. So GL factor in the number of carbs is in a serving of food to GL factors in the number of carbs in serving of food to determine how it affects blood sugar. So if he's consuming 1 kg of strawberry, that's not healthy because it will impact its glycemic load is much higher. Its glycemic index may be lower, but glycemic load is much higher. तो glycemic index, glycemic load, ये दोनों टर्म्स हमें समझ में आए? पक्का? They may any day ask you कि glycemic index refers to which of the following, or which of the following foods are considered to have high glycemic index. तो जनरल अवेयरनेस रहेगा तो मार्किंग थिंग्स विल बी इजी. अवेयरनेस ही नहीं है कि व्हाट इज ग्लाइसेमिक इंडेक्स, तो we will be facing issues. Let's go to non-sugar sweeteners. Non-sugar sweeteners. मीट कहीं नहीं लिखा सर. मीट लिखा ना बेटा, फिश, पाउल्ट्री, यहां सब लिखा था ना. दे डोंट कंटेन कार्ब, तो उनको ग्लाइसेमिक इंडेक्स असाइन नहीं होता है. ओके, let's talk about non-sugar sweeteners. देखो, when we consume sugar मतलब आप ऑरेंज कैंडी, यू नो और व्हाट ऑरेंज कैंडी इज ना, या फिर आप वो कोई टॉफी वगैरह कंज्यूम कर रहे हो, when you're consuming sugar, what happens is that sugar gives you a taste. You like that taste. Sometimes you may like that taste, but that sugar also goes in your stomach. Your stomach digests it, processes it, and that carbohydrate or that sugar goes into your blood. ये नॉर्मल शुगर काम करेगा. अब नॉन शुगर स्वीटनर क्या करेगा? नॉन शुगर स्वीटनर, यू विल कंज्यूम इट, यू विल फील द टेस्ट, मजा आ गया. Sometimes people crave for sweet things, but when it goes in your stomach is not able to process it or digest it. It just gets excreted. So now it has not added to sugar in your blood. It gave you the taste. You wanted, यार कोल्ड ड्रिंक पिला दो बढ़िया सी, है ना. एक दोस्त आया कोक लेके, दूसरा दोस्त आया डाइट कोक लेके. The person who has got coke, that person will be consuming some sugar, because in it normal sugar is there. As it goes in your tummy will process it, and that sugar will be transferred to your blood. But जो ये non diet coke आएगा, you will drink it and you will taste good, and your body will be happy, your brain will be happy. मजा आ गया. But as this goes in your tummy, there is no sugar in it. There was sweetener in it which made it sweet. Your brain felt, मजा आ गया. But it doesn't have sugar that's going to get digested and that's going to go in your blood. It's not there. So these type of sweeteners are non-sugar sweeteners. मीठे, they are sweet, but they are non-sugary. Are we able to understand between sugar sweeteners and non-sugar sweeteners? Sure? Okay. So non-sugar sweeteners or non-nutritive sweeteners, they don't have nutrition. Is carb a macronutrient? कार्बोहाइड्रेट मैक्रोन्यूट्रिएंट होता है ना, इसमें कार्बोहाइड्रेट नहीं है, तो these are non-nutritive sweeteners. They taste sweet. Okay, they are substances used in places of sweeteners that have sugar. Instead of using sweeteners that have sugar, we may use NSS. They have negligible or 0 calorie, because unlike sugar, they don't get broken down in the body and convert into products that provide energy or calories. They don't do that. They just provide you the taste. They provide you that sweet taste. Now, when you get products which are sugar free, कई बार you will see sugar is kept on the table, but उसके ऊपर लिखा है sugar free. Yeah, I was giving you example of Diet Coke. That is what? That is sugar free. They consist of what? They consist of non-sugar sweeteners. क्या हम सबको समझ में आ रहा है what is NSS? Now they can be of two types. They can be artificial, they can be natural. अब natural, like plant-based, some sweet things may be there, which is giving you the taste. मीठा मीठा मीठा, but which is not getting digested in your body, which is not getting broken into nutrients which your body can absorb. So there can be natural non-sugar sweeteners also, and there can be man-made non-sugar sweeteners also. जैसे man-made में aspartame, the most popular one is this. We have saccharin, acesulfame, potassium, sucralose, neotame, advantame. Neotame, advantame, they have been derived from aspartame only. These are lab made. These did not occur naturally. They have manufactured it in lab, and then they are producing it in industry in large quantity. But there are natural non-sugar sweeteners. Stevia, you must have heard of stevia. It is a naturally produced sweetener, but not sugary, non-sugar sweeteners. Thaumatin, monk fruit. These are what? These are non-sugar sweeteners. So, if you go to US, all of these artificial sweeteners that we have listed here, and all three of these natural sweeteners which are listed there, they're all approved by US FDA. But if you come to India में ना advantame, जैसे यहाँ पे advantame is not yet approved, and similarly monk fruit can be consumed as वैसे बाकी तरीकों से, but in general, the general approval to monk fruit has yet not been given as non-sugar sweeteners. समझ में आ रहा है? What are non-sugar sweeteners? Some of the examples, they can be artificial, they can be natural. ये सब समझ में आया? Now, who should be using them, or where are they used? To reduce the consumption of sugar, which has led to global rise in diabetes and obesity. Why has diabetes occurred? Diabetes has increased because of overconsumption of sugar. So for these people, what happens? Non-sugar sweeteners can be okay. Sometimes we see our parents who are elderly, and उन्हें कितना भी मना किया जाए, वो ऐसे रसगुल्ला उठा के खा लेते हैं. होता है ऐसा? तो if we can, रसगुल्ला खाने का मन है, वो बचपन से, जवानी से, बुढ़ापे तक, that's something that has made them happy. So in their body, the happy hormones will be released when they consume that rasgulla. But if that rasgulla can be made up of non-sugary sweeteners, they will enjoy it, they will taste it, but their blood sugar will not spike. पर आते हैं, तो इसका market was of $20 billion in 2022, may go up to $30 billion by 2027. अब आ जाते हैं कि यार criticisms पे, कि there is little evidence to substantiate the benefit of NSS in controlling diabetes and obesity. अब you'll say, sir, ये क्या बात कर रहे हो आप? Why, मतलब, if it's not adding sugar, then why are you saying कि it's not leading to fight, it's not leading to successful fight against diabetes and successful fight against obesity? Ab, in reality, what happens is this. Suppose, think of, let's say, an elderly person in my family, जिनको शुगर है and डॉक्टर ने बोला है मीठा नहीं खाना है. अब उन पर्सन के लिए हमने क्या किया? हमने गाजर का हलवा बनाया, क्या डाल के? नॉन शुगर स्वीटनर. अब उन्हें इतना पसंद आ रहा है, वो 2, 3, 4, 5 कटोरी खाए जा रहे हैं. Why? यार इसमें तो शुगर नहीं है, but गाजर has glycemic index, no? If you will consume a lot of it, glycemic load will go up. आप खीर खा रहे हो, खीर में चावल और दूध भी तो है. By that excuse क्या रे, ये तो चाय पी रहे हो, उसमें दूध है ना. It has carbs in it, it has calories in it. तो obesity को reduce करना है, तो you'll have to be on calorie count, and in the moment you get what? The moment you get, this is sugar free, your calorie count suffers. Then there is growing body of research which also says that NSS may lead to cardiovascular diseases, cancer, and type 2 diabetes. NSS may lead to this. इनफैक्ट कैंसर की बात कर रहे हैं. WHO का एक 2023 का गाइडलाइंस है, which has classified aspartame as possibly carcinogenic to humans. Possibly, abhi we'll understand the meaning of possibly carcinogenic to humans, but it may be carcinogenic also. तो सारे सपने धरे के धरे रह गए. there can be problems. समझ में आ रहा है? So let's look at what aspartame was. Was it a man-made one or a natural one? It's an artificial sweetener which was invented in 1965 and has been in use in USA since early 1980s. This is what it looks like: C14H18 N2O5. Several studies have shown that there are problems associated with aspartame. WHO analyzed 1300 different studies and concluded what? Concluded that it may be possibly carcinogenic to humans. We should not be consuming a lot of aspartame. अब what is meant by something being possibly carcinogenic? तो देखो, things which can cause cancer, WHO has classified them as in group 1, group 2, group 3, and group 1 में वो चीजें हैं, they are definitely carcinogenic. That is, they have shown that humans में क्या हो सकता है? Cancer हो सकता है because of these things. This include tobacco smoking, alcohol consumption, solar radiation, ionizing radiation. Do we understand what ionizing radiations are? We have studied nuclear science and tech. These are carcinogenic. The substance have shown sufficient evidence in humans as well as in animals that a lot of exposure to them may be carcinogenic. Then there is probably carcinogenic. Probably carcinogenic may they have given evidence in animals. There is limited evidence in humans, but evidence is there in animals that these things may cause cancer. It includes insecticide like DDT, red meat, नाइट शिफ्ट वर्क, रात भर जो जाग रहे हैं, मैं भी जाग ही रहा हूं, probably carcinogenic है. Emission from high temperature frying. So high temperature, when you fry things and those particles which come in when you inhale them, that may be carcinogenic. And then there are things which are these are probably carcinogenic. There are things which are possibly carcinogenic. यहाँ पे there is limited evidence in humans or sufficient evidence in animals. It includes aspartame, gasoline engine, heavy metal, and there are things which are not carcinogenic, जैसे coffee या mercury. Mercury may be toxic. Paracetamol, crude oil, these are not carcinogenic. So what is aspartame? In which category is aspartame there? Category 2B, possibly carcinogenic. Actually, there are some other non-sugar sweeteners. One is xylitol. It's a natural sugar found in plants, including many fruits and vegetables. It has sweet taste, and because it's a non-sugar sweeteners, sweet taste तो है, sweetener है ये, but इसमें sugar content is very less. Another very important advantage of this non-sugar sweetener is that it helps in fighting cavity. Now, देखो, ऐसे समझो कि someone who is having cavity or having tooth decay, वो अगर शुगरी चीजें कंज्यूम करेगा तो will bacteria get that food? Bacteria को शुगर मिलेगा? Will they grow more? Will they decay your teeth more? Can they do that? ये समझ में आ रहा है? Okay, पहली चीज. तो people assume this कि if I have diet coke, it is good for my teeth because it doesn't have sugar. अगर मेरे दांतों में शुगर जा रहा है तो there are chances that bacteria will grow more. They'll be able to get food, but this isn't true. आप जब कोल्ड ड्रिंक पीते हो ना, it's so acidic कि it leads to more damages to your enamel, and that is why even non-sugar based जो आपके कोल्ड ड्रिंक्स है, they are not good for you. They may be good for controlling what? Controlling sugar, but they are not good for health as such. They may be carcinogenic. They may be what? They may be creating this problem. Tooth decay and सारी चीज हो रही है. But there is this non-sugar sweetener, xylitol. It doesn't cause tooth decay. It reduces the level of decay causing bacteria in saliva and also act against some bacteria which can cause ear infections. So this is a non-sugar sweetener which has certain other advantages also, and therefore it is used in chewing gums, mints, and other candies. But it has to be understood that it is toxic to dogs and can't be given to dogs. So this has to be kept away from dogs. Okay, तो ये अपने non-sugar sweeteners हुए. अब आते हैं Ozempic. Is this something also which is in news a lot? Let us understand क्या है Ozempic and how do we handle this. देखो, Ozempic या semaglutide. In fact, the term that we should be using is semaglutide. Semaglutide is the chemical which is in there. Ozempic medicine में what is the chemical? Semaglutide. Semaglutide होता क्या है? तो एक तो common sense में it's a medicine which people consume to fight diabetes, to fight obesity. FDA has approved it. India में भी approval है more or less इससे. It is a medicine. But what does it contain? So it consists of GLP-1 receptor agonists. Semaglutide belongs to class of drugs called glucagon-like peptide 1 या GLP-1. And this semaglutide, it mimics GLP or it mimics the action of the hormone GLP-1 which is made by our small intestine. तो होता क्या है? देखो, naturally when we have consumed a lot of food, तो our small intestine produce a hormone called GLP-1 which tells our brain बहुत हो गया, let's not give me more food. We are saying even if your tummy is not full, take this medicine. What does it have? GLP-1. It will tell your brain बहुत हो गया. It will reduce your hunger. It will make you feel full and you will eat less. Are we getting क्या हो रहा है? How Ozempic functions? Your small intestine naturally produces GLP-1. Semaglutide has a similar component. So when it goes in your body gets a message, your brain gets a message. I'm full. And as your body gives you that message, जैसे आप जब when you're really full and someone forces you to eat something, do you feel like vomiting? You'll be like, अब बहुत हो गया, अब नहीं खाना. Even when you have eaten less, that feeling would come. No more food. What does that lead to? That leads to what? That leads to you consuming less food over the period. As you consume less food, less carbs, your body weight comes down, your sugar level comes down, and you're able to fight various obesity associated diseases. Recently, a lot of people जो पूरी life में दुबले नहीं हो पाए थे, in the last 1 or 2 years they've said कि they've worked out a lot और एकदम दुबले हो गए. And फिर न्यूज में यही आता है, did he use Ozempic? Did he use semaglutide? पर हमें क्या समझना है, semaglutide काम कैसे कर रहा है? It's working in the same way as the hormone GLP-1 hormone which is released by small intestine when we are full. It's working like that. क्या layman language में समझ में आ रहा है कि how it will prevent us from eating a lot of other food? तो benefits क्या है इसके? अच्छा, it also slows down the movement of food through stomach. तो food का movement अगर stomach से slow है, तो you'll be feeling full faster and thus your consumption would be lesser. So it has helped in controlling diabetes and weight loss. It has benefit for heart and kidney also, and it has slowed down aging. Some studies have shown that GLP-1 RAs have been shown to protect against oxidative stress, cellular sense and chronic inflammation, which are widely accepted as the major risk for aging. How is the drug taken? So it may be taken in the injectable form, it may be taken orally also. There are various versions available. क्या इसके side effect है? तो yes, you may feel bloated. जैसे आप जब बहुत ज्यादा खाना खा लेते हो तो एकदम भरा भरा सा feeling होता है. You may have that feeling. You may have nausea. Nausea is what? Puke करने वाला feeling. You may feel like that. In rare cases, it may cause stomach paralysis also. Because see, Ozempic is leading to what? Ozempic is leading to slow movement of your food in your digestive system. So it may also lead to paralysis of stomach, causing stomach from contracting, expanding, so this is a food digestive. And then it may also cause pancreas related problem. But bigger problem is that it may lead to muscle loss. आप जब खाना कम कर रहे हो ना, जैसे because of Ozempic, when you are consuming less food, you end up consuming less protein also. As you consume less protein, as your physical activity doesn't happen, what would happen? You will also lose muscles. And it is said, देखो, there are two kinds of people. One, people who run a lot, है ना, उनका heart is very healthy and they'll have a very long life. Generally runners or people who have healthy hearts, they have long life. But if you are not lifting weight, in that case your runner, तो आपका life लंबा तो होगा but painful होगा. If you want कि what should happen कि you have a very healthy life also, कि लंबा जियो पर 80 में भी you're able to move around things, you're able to live at your own, you have to start lifting weight now. When you lift weight, your muscles are built. जब आप weight उठा रहे हो तो आपके हाथ ऊपर उठ रहे हैं, उसके वो मसल्स बिल्ड हो रहे हैं which are needed to help you in this movement. As you grow old, आप ऐसे करोगे तो हाथों में दर्द नहीं होगा because muscles have been built, muscles are supporting you. If you just keep running कि मुझे दुबला होना है, भाग लो and don't work on the muscles, you may face more injuries, you may face painful old age also. That is why Ozempic is also leading to what? Ozempic is also causing the problem of muscle loss. क्योंकि यहाँ पे आप ऐसे एक्सरसाइज से तो वेट लूज कर नहीं रहे, तो what is going to happen? Your muscles are going to get degraded, get lost as you're consuming less food. And that's why generally you will see people who are losing weight after with Ozempic. आप उनके चेहरे पे ना एक वो भी देखोगे, डलनेस, है ना. दो करण जौहर सेज कि उन्होंने Ozempic यूज नहीं किया है कि नहीं किया, करा है, मुझे नहीं पता, बट अर्लियर करण जौहर चाहे वो थोड़े ज्यादा वेट वाला था, बट डिडंट ही लुक बेटर? नहीं, अभी वाला ऐसा लग रहा बूढ़ा सा हो गया अचानक से, नहीं ऐसा लग रहा है ना. तो if the weight loss was happening through what? Through proper exercise, that would not have happened. He would have looked younger. That is why Ozempic should only be taken, these medicines should only be taken when आप ना बहुत obese हो गए हो and अभी आप move भी नहीं कर पा रहे हो, you cannot do physical activity, you have gained so much of weight. At that time Ozempic can reduce your food consumption and can reduce your weight so that you can start moving, and then you should start moving. Else lifelong you cannot keep taking this drug. It can become a huge problem. So we should not be taking it. It should be treated as what? It should be treated as something which doctors prescribe for people who are suffering from high diabetes, people who are suffering from high levels of obesity. समझ में आ रहा है? How it functions, good things, bad things. दूसरा एक और चैलेंज होता है कि कॉस्ट. 30 tablets of 3 mg Ribelsus cost around 10,000 rupees, which is like 10,000 rupees a month का cost. So not everyone would be able to afford it, not everyone would be able to deal with it. Okay, बाकी अल्कोहल और कैंसर के बारे में ये है कि यार sometimes no, we keep on getting these things कि half a glass 30 ml of whiskey every day will keep you healthy. सब बकवास है. अब हम वाइन पिएंगे तो 60 से नहीं होगा कुछ, है? आप नहीं बोले हो. तो alcohol in any quantity is bad for us. We should not be consuming it, period. Alcohol is not something that should be consumed. मुझे पता है न्यू ईयर के दिन मेरे क्लास में बच्चे कम क्यों थे, है ना, रात में आप लोग क्या कर रहे थे मुझे पता है, but you should not be doing that. Okay, let's talk about prostate cancer. Prostate cancer is also something जो आप regularly न्यूज में सुनोगे. जिम कंपटीशन में जाने से पहले लोग कुछ टाइम से ये यूज करते हैं. मेरा एक फ्रेंड लेता था जब वेट बढ़ जाता था तो. मतलब वैसे जरूरत नहीं पड़नी चाहिए ना, आप अपने वेट कैटेगरी में रहो ना, कीप योरसेल्फ हेल्दी. इट शुड बी टेकन एज मेडिसिन, नॉट एज वेट लॉस करना है सबको, एकदम ऋतिक रोशन बनना है, तो सब लोग ओलंपिक खा खा के वो बन जाओ, नहीं, दैट्स नॉट गुड सस्टेनेबल वे ऑफ सर्वाइविंग, दैट इज नॉट व्हाट शुड बी डन. ओके, लेट्स कम टू प्रोस्टेट कैंसर, लेट्स अंडरस्टैंड दैट. देखो, डिड वी स्टडी सर्वाइकल कैंसर? अब यार सर्विक्स सिर्फ विमेन में होता है ना, तो सर्वाइकल कैंसर सिर्फ उनको हो रहा है, तो फिर गर्ल्स शुड नॉट फील डिस्क्रिमिनेटेड कि यार ये कैंसर भी हमें दे दिया. तो भगवान ने लड़कों को दिया प्रोस्टेट. ओनली बॉयज हैव प्रोस्टेट एंड ओनली दे हैव प्रोस्टेट कैंसर. ओनली मेल्स हैव प्रोस्टेट कैंसर. क्या होता है प्रोस्टेट, व्हाट इज इट्स फंक्शन एंड व्हाट इज दिस कैंसर एंड हाउ इट शुड बी प्रिवेंटेड, वो हमें थोड़ा सा समझना पड़ेगा, बिकॉज इंडिया में प्रोस्टेट कैंसर के बारे में देयर इज नॉट अ लॉट ऑफ अवेयरनेस, एंड बिकॉज ऑफ दिस a lot of people are suffering. Why does that happen? In the absence of awareness, तो प्रोस्टेट कैंसर को ना एक्चुअली स्क्रीनिंग ऑफ प्रोस्टेट कैंसर शुड हैपन. आप अगर ऐसे 60 साल के हो गए हो तो रेगुलर स्क्रीनिंग फॉर प्रोस्टेट कैंसर शुड हैपन सो दैट it could be detected at earlier stages and can be dealt with in a proper manner. But India में that's not happening, and that's why India में prostate cancer deadly होते जा रहे हैं. You detect it only in the later stages, and that's why this remains in news. तो what is prostate? पहला देखो, this is urinary bladder, this is scrotum, वहां पे sperm produce होंगे, right? You'll see that this sperm and this urinary bladder, ये दोनों are passing through a gland known as prostate gland. Urinary bladder से urine, in case of male it's released from the same organ, urine as well as the sperm, but यहाँ पे बीच में प्रोस्टेट कैंसर आया. तो यू विल सी इन योर नोट्स इट्स रिटन कि रेक्टम के सामने यूरिनरी ब्लैडर के नीचे देयर इज व्हाट, देयर इज प्रोस्टेट ग्लैंड. कहाँ है लोकेटेड, ये वी अंडरस्टैंड. नाउ व्हाट डज इट डू? तो it contributes additional fluid to your semen, to your ejaculation. Ejaculate is a whitish gray fluid that releases from your penis when you reach orgasm. It contains enzyme, zinc, citric acid, which help nourish sperm and lubricate your urethra. Urethra is the place from which it will pass through. Prostate muscle also, so prostate helps in adding more fluid to your semen, and it helps in the prostate muscle helps in pushing semen in through your urethra. These are the main functions of the prostate. Now, location तो अपन ने देख लिया. In case of women, they don't have prostate, but women and people assigned female at birth, they have skeneous gland. However, some people refer it as female prostate gland, but it's not actually prostate. Sperm is produced by testes and not prostate. Please note that. तो testicles में sperm produce होंगे. It is not prostate which is producing it. Prostate is just adding some fluid to it. Then urethra, it is the tube through which this is urethra. It is the tube through which your urine flows or your ejaculation flows. Prostate cancer क्या है? It is the most common type of cancer that affect men and people assigned male at birth. जैसे कोई a person who was assigned male at birth, वो पर अपने आप को अभी फीमेल बोल रहे हैं, उनको भी प्रोस्टेट कैंसर हो जाएगा. बस अपने आप को ट्रांसजेंडर पर्सन में से कि आई वाज असाइन्ड मेल एट बर्थ बट आई एम नॉट मेल, बट दे हैव प्रोस्टेट, नो, दे मे कॉल देमसेल्व्स फीमेल बट दे हैव प्रोस्टेट, तो दे मे आल्सो गेट प्रोस्टेट कैंसर. आर वी गेटिंग दिस? सिचुएशन क्या है इंडिया में? तो प्रोस्टेट कैंसर अकाउंट्स फॉर 3% ऑफ ऑल कैंसर्स विथ एन एस्टिमेटेड 32,000 to 42,000 new cases diagnosed annually. But it's also believed that most of the cases diagnosed ही नहीं होते हैं. Like how many people have we actually seen कि वो prostate cancer के लिए screening face कर रहे हैं and all? So large proportion of cases are diagnosed in advanced stages, which means that cancer has spread at the time of diagnosis. Therefore, 65% of the patients die of the disease. Recommendation क्या है? Early testing in men over 60. Simple. If our parents are turning 60, it's important that we do what? We keep on doing early screening. We keep on them getting early screening so that in early stages only this thing could be detected. समझ में आ रहा है ना? Prostate cancer, another, देखो, this was not a contagious disease. This was a form of cancer which is not contagious, which is not non-communicable. तो इसीलिए हमने in non-communicable diseases, we are not talking about all the cancers, only the cancers which are in news a lot. हम इसे medical science का class नहीं बना सकते हैं. We are talking about most important things. PYQs we should be able to answer, and then current affairs में जो चीजें हैं we should be able to cover that. Now let's talk about antimicrobial resistance a bit. Antimicrobial resistance, देखो simple ऐसे समझो, let's say this is the bacteria which is causing TB, Bacillus tuberculosis, or it is the TB bacteria. Now when we are infected by TB bacteria, we take antibiotics, है ना? We take antibiotic. This may happen that, let's say we are taking one antibiotic. This is a bacteria. To kill it, we are taking one antibiotic, and this antibiotic is able to kill, or this medicine is able to kill 99.9% of these bacteria. It is able to do that. कितना समझ में आया? It is able to kill 99.9% of these bacteria. But 1 out of every 1,000 has survived. 99.9 चले गए, फिर भी 1,000 में से 1 bacteria has survived. Why have they survived? They have survived because they are immune to this antibiotic. अब next round में these bacteria may grow again, but these may have slightly higher population because they have survived from previous generation. अभी environment से more of these bacteria may come, but this will have higher population. You kill them again, but this time they'll be more, and they'll be surviving more. And with time, resistance develops. With time, with medicine, you will not be able to kill these bacteria because most of them are with those genes which are resistant to this medicine. At that time, we say that these bacteria have developed what? Antimicrobial resistance, yeah, antibiotic resistance. Now they are not getting killed by the this. I say tomorrow some alien may come, or some advanced aliens, and they look at us and they say कि ये इंसान बड़े अजीब से हैं. They have themselves divided them into different countries, different caste, different religion. ये लोग आपस में एक दूसरे पे गोलियां मार रहे हैं, ये अपने एनवायरनमेंट को भी डैमेज कर रहे हैं. अगर some intelligent human comes and looks at us in future, या अभी भी, won't they feel that? एकदम कतई गधेड़े लोग हैं. They're damaging their environment, they're damaging their earth, they're killing each other. वो अपने घर से कचरा निकाल के घर के बाहर फेंक दे रहे हैं, वो भी उनका ही है. That space also belongs to them. चलो इनको मार देते हैं. Suppose the aliens decide this and they put some toxin. ऐसा होगा कि not all 8 billion of us may die. Some of us may have those genes which are resistant to those toxins. A few of us may survive. But next generation, those genes will increase more and more. So we have developed resistance against that toxin. ना तो anti-toxin resistant हो जाएंगे हम. यहाँ पे वो बैक्टीरिया कर रहे हैं. Bacteria are becoming resistant. ये समझ में आया? तो you will say सर ये तो natural process है, eventually हो ही जाएगा. So yes, this is a natural process, but it has been sped, or it has been speeded up by human activities. What are those human activities? Why antimicrobial resistance are emerging more now? One reason is excess use of antibiotics. If you are not using antibiotics a lot, so all the bacteria would have survived and not the ones which are resistant. फिर someone is suffering from some bacterial infection, you can give the medicine and most of the bacteria will die, this person will become healthy. But when you're using a lot of medicines when it is not needed, they say India mein it is said that our children get lot more antibiotics than what we get, about what children in US get. हमारे यहाँ डॉक्टर के पास चले जाओ बच्चे को लेके, छोटे बच्चे को लेके, that doctor will write a lot of, और डॉक्टर्स नाराज नहीं होंगे, मैं सब पढ़ के बता रहा हूँ ना, मेरे को कुछ पता नहीं है, ऐसे पता लगे आप में से कोई डॉक्टर मुझसे नाराज हो गए, बट डॉक्टर्स राइट अ लॉट ऑफ एंटीबायोटिक्स. तो इंडिया में एक तो कल्चर ही है क्या कि डॉक्टर्स टेंड टू राइट मोर एंटीबायोटिक्स, बट मोर वर्स देन दैट, we the non doctors of us start feeling we know the medicine that should be given. We go and buy medicines over the counter. कोल्ड होगा सब जाके azithromycin खरीद लेते हैं. Azithromycin is an antibiotic which should not be bought without doctor's prescription. अबे तुम्हें फ्लू हुआ है, that's a viral disease, but what are you consuming? Antibacterial disease, antibacterial medicines. So that leads to over the counter availability of these medicines, leads to overconsumption. Not only this, हम देखेंगे कि in our animals a lot of antibiotics are used, that's very unregulated, that leads to overconsumption. Our pharmaceutical waste, when it is dumped into environment, a lot of discarded antibiotics may go into environment. Excess antibiotics in environment may lead to generation of antibiotic resistance in environment. फिर unhygienic conditions कौन से? Around us all the conditions is unhygienic. बाहर जाओ, रोड पे सुसु कर रखे लोगों ने ना. You are in one of the most expensive places in India. एक रूम का 25,000 रुपए, वो छोटे से गुफा जैसे रूम का. बहुत कम जगह इंडिया में जहां पे आपको ये देना पड़ेगा. You are in one of the most expensive places in India. And still we live in very unhygienic conditions. When that happens, the chances of us falling sick is higher. As we fall sick more, we take antibiotics more. फिर से ज्यादा एंटीबायोटिक आ गया, causing the problem of antibiotic resistance. So all these things eventually lead to more antibiotic resistance. फिर suppose these bacteria have become resistant to first line of antibiotic, we will bring second line of antibiotic. But इसका भी unregulated use होगा, it may become resistant to this also, we may bring third line of antibiotic, and eventually the line may end and this bacteria cannot be killed anymore. This can be called superbug. Why superbug? Now I'm not getting killed. And as more of these superbugs develop, human life is a threat. Something as simple as simple surgery. कोई आपका ऐसे काट के थोड़ी छोटी मोटी कोई सर्जरी करनी थी, but if in environment those bacteria are there which can infect you, this surgery may become deadly. Why would it become deadly? It would become deadly because once the bacteria has infected you, there is no treatment. Generally, when surgery takes place, the doctors also give you some antibiotics so that you don't get infected when you're going through, when your body is being opened. So the bacteria in the environment should not be infecting you, or even if they infect you, they are being killed by the antibiotics. But if we have more of these antibiotics, what would happen? Oh, sorry, if we have more of these superbugs, these antibiotics will not be able to kill them, and even simple surgeries may become difficult. तो ये है सिनेरियो ऑफ एंटीबायोटिक रेजिस्टेंस. इट रिमेन्स इन न्यूज थ्रू आउट. बहुत सारा मैं पढ़ाता रहा हूं, बट मैंने कहा ठीक है, इसे बस क्लास में डिस्कस कर लेते हैं. डू यू ऑल अंडरस्टैंड व्हाट इज एंटीमाइक्रोबियल रेजिस्टेंस और एंटीबायोटिक रेजिस्टेंस? ओके, लेट्स गो टू स्मोकिंग, ड्रिंकिंग एंड अदर स्टफ. हंस क्यों रहे हो बिंदु? लेट्स गो. अच्छा, लेट्स गो. नो स्मोकिंग, ड्रिंकिंग. दिल्ली में रह रहे हूं, ऑलरेडी बहुत स्मोक करता हूं. स्मोकिंग के अब देखो, National Family Health Survey 5 says that among people aged 15 years and above, 28% use at least one form of tobacco. You're all 15 years and above? 28% of us use some form of tobacco. कौन सा आप यूज करते हो? आपके केस में आई थिंक सिगरेट सबसे ज्यादा यूज होता है. कोई बीड़ी वीड़ी भी पीता है? दिव्या? नहीं, कभी नहीं. अरे छत पे बैठ के अरे बीड़ी दे यार, सिगरेट में फील नहीं आ रही. नहीं, स्ट्रॉन्ग चाहिए आज कुछ. तो 28% of us are doing it. National Family Health Survey 5 says, now to prevent a lot of tobacco consumption, there are initiatives. There are various government initiatives. There is COTPA, Cigarette and Other Tobacco Products Act 2003. It discourages its consumption. It has also banned tobacco advertisement, promotion, sponsorship, sale to minors. It has also banned smoking in public places. अब tobacco advertisement banned है, but जुबान केसरी तो चलता है ना. इलायची बेच रहे सब. तो बेसिकली इनडायरेक्टली टोबैको इज बीइंग सोल्ड. टोबैको इज बीइंग सोल्ड. ऐसे ही दे से दैट इट्स बैंड, स्मोकिंग इज बैंड इन पब्लिक प्लेसेस. कौन से पब्लिक प्लेस पे बैंड है? टेल मी वन पब्लिक प्लेस. पार्लियामेंट के बाहर ना, पार्लियामेंट के बाहर एक वो है, पान की शॉप है. हाँ, आप कभी पार्लियामेंट वहां से यहां से वॉक करके जाओगे ना. इन 2022 आई वाज जस्ट, मैं वॉक करके दिल्ली घूमता था. तो मैं यहाँ से कभी इंडिया गेट जाता था, यहाँ से कभी लोधी गार्डन वॉक करके जाता था. हाँ, एक दिन आई यूज्ड टू टेक अ डे ऑफ, आई पुट ऑन अ मास्क एंड जस्ट वॉक अराउंड. मैं देख रहा था कि वहीं पे पास में आगे वो शॉप्स है जहां पे टोबैको वगैरह आराम से मिल रहा है, सिगरेट वगैरह आराम से. मैंने कहा लॉ बनाने वालों के आसपास ही लॉ ब्रेक हो. अंदर भी मिलता है. कौन से क्वार्टर? अच्छा, वो तो विल कम टू दैट, विल कम टू दैट. हाँ, विल कम टू दैट. अभी आ रहे हैं. इलेक्ट्रॉनिक निकोटीन डिलीवरी सिस्टम, विल अंडरस्टैंड दैट. वो तो कंप्लीटली बैंड ही है, बट ये चल रहा है. फिर सिगरेट एंड अदर टोबैको प्रोडक्ट्स पैकेजिंग एंड लेबलिंग रूल्स 2008 है. इट प्रोवाइड्स फॉर हेल्थ वार्निंग ऑन टोबैको प्रोडक्ट्स. वी हैव सीन इन व्हेन आई वाज अ किड, तो ना इन प्रोडक्ट्स पे इतनी वार्निंग नहीं होती थी. अभी वो डेंजरस वाली वार्निंग रहती है, बट नो वन केयर्स. फिर इन मूवीज वी नो मुकेश इज वेरी फेमस, है ना. बिफोर द मूवी अभी मुकेश ही आ रहा है, क्या आ रहा है? अभी मुकेश ही है. चेंज हो गया? कौन आ गया है? कॉपीराइट खत्म हो गया. चलो फिर देयर इज नेशनल टोबैको कंट्रोल प्रोग्राम which aims at creating awareness, reducing production and supply of, ensuring implementation, compulsory health warning in movie theaters before screening of movie, complete ban on e-cigarette. ये important है. This 2019 act which has banned e-cigarette का production, manufacturing, import, transport, sale, distribution, storage, advertisement. E-cigarettes are not allowed. E-cigarettes में basically nicotine होता है vaporized form में. That is completely banned. And किसी भी पान वाले के पास चले जाओ, वो दे देगा आपको. नहीं देगा? नहीं देता? तुम्हें किसने नहीं दिया? दोस्त लेते ना. तुम तो एकदम सीधे हो. नहीं देते? क्या बोलते हैं? पीछे से लेना पड़ता है. तो ये सिनेरियो है. We have rules, regulations. अभी in current updates I'll talk about the changes which have taken place. अभी जैसे टैक्स में changes हुए हैं about tobacco and all. We'll talk about, जब मैं GST वगैरह पढ़ा रहूंगा at that time I'll explain that. But there are norms, rules, regulations. But in spite of all this, we know कि situation is worsening. More and more youth is into smoking, is into consuming tobacco products. Tobacco mostly smoking के form में consume हो रहा है. एटलीस्ट गुटखा नहीं खाते आप लोग? नहीं? किसी ने ऐसे कॉल, सर मुझे डाउट बता दो. एटलीस्ट गुटखा नहीं खा रहे हो, ठीक है. there is a WHO initiative also, Framework Convention on Tobacco Control, FCTC. WHO का इनिशिएटिव है। ऐसे ही देयर इज इनिशिएटिव लाइक टोबैको फ्री जनरेशन वेयर द सेल ऑफ टोबैको टू पीपल बोर्न आफ्टर अ पर्टिकुलर डेट इज प्रोहिबिटेड। अब ये इसका आइडिया क्या है, देखो वी कैन, जैसे न्यूजीलैंड सेड कि यार वी कैन नॉट डू दिस इमीडिएटली कि टोबैको सेल इज बैंड, बट व्हाट वी कैन डू इज दिस कि एनीवन, जैसे सपोज इंडिया में वी मेक दिस रूल, एनीवन हु इज born after 2010, that person is अभी 15 years of age, anyone born after 2010 उसको सिगरेट नहीं बेची जाएगी। तो इट्स नॉट अ ड्रास्टिक थिंग, बट स्लोली it will cover 16-year-old people, 17-year-old people, 20, 21, 25 and so on. So this is the mechanism which has been used in some New Zealand and all to reduce the tobacco consumption. So there are some international initiatives also. थोड़ा सा e-cigarettes को समझते हैं। देखो, when we consume tobacco, when we are doing this smoke going in our lungs, but actually it is what we are craving for is nicotine. It is nicotine जिससे we become addict. When someone is consuming tobacco, what do we want? We want nicotine. No one wants that smoke. आपका दोस्त चाहता होगा, स्मोक भी चाहता है, पता नहीं, ये नहीं पता। और आपका अपने से भी नहीं पूछा। चलो, तो it's basically what do we become addicted to? We become addicted to the nicotine, and that's why for people leaving smoking is very difficult. तो एक प्रोडक्ट was developed, इलेक्ट्रॉनिक निकोटीन डिलीवरी सिस्टम ENDS, उसमें ना निकोटीन के वेपर होता था, एंड rather than consuming the entire tobacco you will just use that device, उसमें there is some electricity वाला mechanism which will heat the vapor, heat the liquid nicotine, and your body will get what? The nicotine. So your craving for the tobacco products will reduce, and it was believed initially that this can be the mechanism by which people would move away from smoking. पहले उन्हें सिगरेट से दूर करो, निकोटीन का क्रेविंग हो रहा है, निकोटीन मिल रहा है, एंड दिस में बी हेल्दी, ऐसा बोला गया था। बिकॉज यूर नॉट कंज्यूमिंग स्मोक, सो यूर नॉट टेकिंग इन स्मोक, स्मोक में देयर वुड बी अ लॉट ऑफ कार्सिनोजेंस। तो इलेक्ट्रॉनिक निकोटीन डिलीवरी सिस्टम got introduced globally through for this purpose. ENDS, electronic nicotine delivery system, got introduced for this purpose. क्या है, समझ में आया कि rather than like we are not able to convince people कि आप सुट्टा मारना बंद करो, we are not able to convince them. Why? Because they have become addicted. So to fight addiction, let us come up with electronic nicotine delivery system. They are addicted to nicotine. Nicotine इनको देते रहेंगे, but they'll keep getting nicotine through ENDS, and slowly it can also be phased out. But the impact was reverse. Impact was reverse कैसे? जैसे अब when this electronic nicotine delivery system started coming, निकोटीन था, बट निकोटीन में कभी वो ऑरेंज फ्लेवर लेके आ जा रहे, चॉकलेट फ्लेवर लेके आ जा रहे, मिंट फ्लेवर लेके आ जा रहे, मैंगो फ्लेवर लेके आ जा रहे। अब धनंजय को मैंगो पसंद है, अब धनंजय 15 साल का है, उसका दोस्त बोलता है भाई ये ट्राई कर, मजा आ जाएगा, असली में। तो नाउ अदरवाइज ही वुड नॉट हैव चोजन सिगरेट, he would not have used cigarette, but it is appearing like, oh, some candy is there, you know, it's not cigarette. So lot of young people got into using electronic nicotine delivery system. They became addicted, and then they moved to original cigarettes. So its impact was ulta, reverse. Plus later it was also realized कि amount of nicotine that is going through this in your body is way higher than what was going through cigarettes. फिर it was also seen that the liquid which is there, which is vaporized, it doesn't only have nicotine, no, it has other solvents also, and it also consists of carcinogenic substances. The liquid consists of carcinogenic substance, तो आप वो breathe in कर रहे हो, and several studies showed कि ENDS is not good. It is the gateway through which young people are getting into smoking. धनंजय 15 साल का है, उसे निकोटीन की आदत लग गई है, धनंजय goes to college, पहले दिन रैगिंग में सीनियर बोलता है ये क्या पी रहा है तू, ये पी। हुआ ऐसा? नहीं? तुम्हें जुगनू डांस नहीं कराया? अब नहीं होता? होता है? होता है? किसको कराया गया है जुगनू डांस? तुम्हें कराया गया है? तुमने भी किया था? तुम, तुम्हारी हरकतों से लग नहीं रहा। नहीं, जैसे बॉन्ड बन रहे होते ज्यादा कुछ करते नहीं है ये लोग। अभी भी होता है? चलो कोई बात नहीं। किसमें होता है? एक्स्ट्रा करिकुलर में? एक्स्ट्रा करिकुलर में होता है, चलो ठीक है। वेट वेट वेट, कम बैक कम बैक कम बैक। इलेक्ट्रॉनिक निकोटीन डिलीवरी सिस्टम के नेगेटिव इंपैक्ट्स देखे गए एंड गवर्नमेंट फाइनली डिसाइडेड दैट इट विल बी कंप्लीटली बैंड। ENDS का मैन्युफैक्चरिंग, प्रोडक्शन, सेल, परचेज, एवरीथिंग इज बैंड technically on papers, but we have seen an MP smoking in the parliament which made the law कि electronic nicotine delivery system is banned। भाई वहीं पे go to any pan shop, they'll give you 500 rupees, 1000 rupees, 1500 rupees, 2000 rupees, 3000 rupees। कौन सा ब्रांड चाहिए, कौन सा फ्लेवर चाहिए, and they'll also look like some एकदम expensive device। So it continues to be sold, it's there in the market, it's there everywhere। It's very easy to access ENDS, like government is literally sleeping here। जब पार्लियामेंट में वो स्मोक कर रहे हैं तो पता है ना कि भाई बिक रहा है। It's happening, they're just making laws and chill, कोई फर्क नहीं पड़ रहा। E-cigarettes, I hope we understood what e-cigarettes के फंडे are। Spurious liquor or Hoots tragedies। Let us understand this topic of spurious liquor also। You must have heard this, पूरे साल में कभी ना कभी होगा कि because of नकली शराब or spurious liquor, some people died, some people faced food poisoning, some people got blind। You must have seen that, right? Why does this happen? Let us understand that। देखो धनंजय, आप तो ड्रिंक भी नहीं करते होगे, है ना? एकदम सीधे बच्चे हो। ओके, साक्षी हंस क्यों रही है? तुम्हें पता है धनंजय सीधा नहीं है, है? तुम्हें न्यू ईयर पे तुम्हें पता है तो मैंने तुम्हारा स्टेटस देखा था, तुम वो छत पे बॉटल उठा के जो डांस कर रहे थे। कुछ भी नहीं करते, बस डांस कर रहे थे। तो लेट्स कम बैक। व्हाट हैपेंस इन स्पूरियस लिकर वाला केस, व्हाई डू पीपल गो ब्लाइंड एंड वो चीजें होती है। देखो देयर इज इथाइल अल्कोहल या इथेनॉल। Ethanol is something that can be consumed by our body। We should not be consuming a lot of it, even that is cancerous, we have already seen। But ethanol का ही एक cousin है methanol। It tastes like ethanol, it feels like ethanol, but when it metabolizes, when methanol in your body metabolizes, it forms formic acid। When methanol metabolizes, methanol will form formic acid। And generally, if your body takes in more than 30 ml of methanol, the amount of formic acid formed is so much that it may kill a person, it may make a person go blind, digestive system में issue होगा, problems। So in spurious liquor, what happens? It is basically methanol which gets added, which becomes a problem। क्या हमें समझ में आया? So it is, the problem is because of methanol। Now the question is कि why would methanol get added? है ना? एक तो ना यार methanol is way easily available than ethanol, but now once the tragedy occurs, the spurious liquor makers should not be using methanol। But why does methanol still go there? देखो please understand, इलीगल लिकर मेकर्स, जैसे गुजरात में शराब इज बैंड, बिहार में शराब इज बैंड, गो टू द रूरल बिहार एंड रूरल क्या, कहीं भी चले जाओ आपको शराब इजीली मिल जाएगी, राइट? शराब इजीली किसे मिल जाएगी? से 10-15 years back I had a friend in IIM अहमदाबाद, तो मैंने 10 साल पहले I had a friend in IIM अहमदाबाद, मेरा बैचमेट था, मैंने उससे बोला बेवड़े तू पीता कैसे अब? मतलब मैंने कहा गुजरात तो ड्राई स्टेट है, बोलता भाई पिज्जा से ज्यादा फास्ट डिलीवरी होती है। He was talking about IIM Ahmedabad 10 years back. Same is the case with Bihar. Alcohol is kind of available. किसके लिए available है? Someone who is able to pay higher. People who are not able to pay higher, they will consume the alcohol which is illegally manufactured, unregulated way में manufactured. अब alcohol बनेगा कैसे? Alcohol बनेगा fermentation से. And then when they do fermentation, they also use distillation वाला mechanism to filter out, separate out things. Methanol's boiling point is something else. Ethanol's boiling point is something else. Water's boiling point is something else. In this way, they separate methanol, ethanol, and everything. But अब बताओ, illegal चूल्हे पे उबाल के बनाया जा रहा है. There will be cases when this separation has not happened effectively. And when this has not happened effectively, there will be some lot going where what is there? There is more methanol there. And as more methanol is there, वो, let's say, what's your name? अंबर, अंबर रोज पीता है, वही नकली वाली स्पूरियस लेकर, है ना, पी पी के दुबला सा हो गया। ऐसे बेवड़े लोग ना, अंबर इज दैट पर्सन। अंबर रोज ले रहा है और रोज पी रहा है। अंबर कहां से लेते हो? बनवा लेते। तो अंबर रोज ले रहा है, पी रहा है। इस बार भी अंबर शाम को गया और अंबर ने लिया। अंबर को तो लग रहा है कि यार बट इस पैकेट में देयर इज मोर मेथनॉल एंड व्हाट हैपेंस? भाई का पेट दर्द शुरू होगा, ब्लाइंडनेस होगी, वो टॉक्सिक लेवल पहुंच जाता है मेथनॉल का, इट क्रिएट्स प्रॉब्लम। नाउ पता है आपको, इवन इन प्लेसेस वेयर नॉर्मल अल्कोहल इज अलाउड, जैसे गो टू उत्तर प्रदेश, उत्तर प्रदेश में तो लीगल सेल ऑफ अल्कोहल इज अलाउड नहीं? अलाउड है? क्या बात कर रहे हो सर? मेरा पूरा धंधा है वो, है ना, अलाउड। बट वहां पे भी स्पिरिट्स लेकर मिलता है ना? ऐसे योगी बाबा नाराज मत हो ना, ऐसे कैसे बोल दिया? स्पिरिट्स लेकर मिलता है आपको, यूपी में मिलेगा, राजस्थान में भी मिलेगा, मध्य प्रदेश में मिलेगा, सारे स्टेट्स में, हर जगह मिलता है। वहां पे क्यों? व्हाई आर पीपल लाइक अंबर प्रेफरिंग टू बाय दिस? अब एक और रीजन होता है, देखो, व्हेन वी आर बाइंग regulated branded alcohol, there is restriction on how much ethanol can be there. There can be like whiskey में 40%, किसी में 16%, किसी में 5%, किसी में 3%. But when it's from unregulated sector, there can be higher amount of. अब for a person like Amber, जो रोज पी पा के पड़ा रहता है, he needs more kick. He is not getting it from the regulated ones. Like हमको वही चाहिए। कौन सी? अनरेगुलेटेड वन। संतरा नहीं, देखो प्लीज अंडरस्टैंड, देशी लाइक देसी शराब में ऑल्सो भी रेगुलेटेड वन, देयर आर सम इलीगल वंस जिसमें बिल्कुल देयर विल बी नो रेगुलेशन, ना? तो अंबर, व्हाट इज योर फेवरेट ब्रांड? चलो, एनीवेज, आई होप हमें ये इशू समझ में आया। स्पूरियस लिकर, मिथेनॉल, मिथेनॉल से फॉर्मिक एसिड, sometimes like earlier there were cases where methanol was intentionally used, but when they realized कि because methanol is easily available, it may have been intentionally used, but methanol का intentional use, कोई एक पैकेट की जगह 5 पी गया और amount of methanol in the body can increase. So generally that is not what is happening now, but what is happening during the time of separation of ethanol, methanol, there may be errors. क्यों आप गांव में बैठ के कर रहे हो, आप अनरेगुलेटेड वे में कर रहे हो उसे. There may be sometimes errors which may lead to more methanol in the alcohol, more formic acid in our body, and other associated problems. I hope we get it. I hope we understand this. Okay. Sir, is it possible to make GM tobacco to remove carcinogenic material? Wow. No, we are running crop diversification program where farmers who are dependent on tobacco उनको डाइवर्सिफाई किया जा रहा है इन अदर प्रोडक्ट्स. ओके, तो ये हो गया स्प्यूरियस लिकर वाला इश्यू. ड्रग्स एंड एसोसिएटेड इश्यूज, इसे ब्रेक के बाद करें. एकदम आज दारू सिगरेट ड्रग्स है, क्या बोल रहे हो? ये लोग जाके वही करो ना. ये लोग, तुम इन लोगों में नहीं आ रही हो नलायक. चलो, इट्स 5:50, तो 4:50 5:20 पे हाफ एन आवर का ब्रेक होगा. लेट्स मीट एट 5:20. ओके, चलिए शुरू करें. अच्छा, सम स्टूडेंट्स आर आस्किंग सम डाउट्स. प्लीज लेट मी नो, क्या डाउट्स हैं? जल्दी जल्दी बताइए. यस. न्यूक्लियर टेक्नोलॉजी में so थोड़ा डाइवर्ट कर रहे हैं. He has some doubt related to nuclear science and tech. So before we go back to health, let me quickly take it. When we want to make a weapon, nuclear weapon, we would want कि when our neutrons strike, they should be able to find uranium-235 so that big explosion could take place. And that is why in our rod, more U-235, up to 90% U-235 should be there. Now, what happens is, let's say, when Iran was trying to make nuclear weapon, एक Iran US Iran nuclear deal हुआ था, है ना? So when Iran was trying to make weapon, they had reached a enrichment level of around 20%. I'm talking about the year 2014-15, जब deal sign हुआ था, and they were slowly moving towards वो number जहाँ पे they have so much of enriched uranium that U-235 could be it could be used in weapon. So generally, if you need weapon, you should have highly enriched uranium, 90%, 95%, like that. Okay. Iran still doesn't have weapon grade uranium. 20% तो पहुंच गए थे. So why did you have this doubt? तो उसमें मतलब लिखा हुआ है, वो ऑथर भी मतलब सही से बढ़िया. देखो क्या होता है ना, when it comes to competitive examination books, most of the time these books are being written by not the teacher but by aspirants. टीचर अपने नोट्स तो खुद बनाते नहीं है. You expect कि books would be written. मैं बहुत सारे लोगों को जानता हूँ, books are always written by some aspirants, जो सीनियर लेवल पे उनके साथ काम कर रहे होंगे वैसा. Right? Why am I not able to write it? I'm not able to write it because मैं बोलता हूँ मैं किसी से नहीं लिख पा. I want to do everything myself. So I'm not able to. मैं इतना कंटेंट बनाता हूँ. Just imagine this. I make so much of I make all of this content myself, but I'm just not getting ऐसे 7 days कि मैं उसे बुक के फॉर्म में मॉडिफाई कर लूं. तो वो कब कर पाऊं, जब मैं किसी और को, तो फिर बनती नहीं ना बात. Okay. Anything else? Any other doubts? Yes. AC we will study tomorrow. Electronics में will understand how AC functions. Okay. करवा दो उसको. क्या चलाना है, बंद करना है? चलाना है. ओके. चलिए, तो अब ना ये अच्छा, बेटा आई डोंट नो. मतलब कुछ नया टेक्नोलॉजी आया है, उसके इतने डेप्थ में जाके पढ़ना पढ़ाना है क्या? आपने पीवाईक्यू देखे ना बायोटेक के. आर दे आस्किंग यू कि अंदर जाके क्या हो रहा है? In any way are they asking you that? I've seen some teachers take 2 hours to just teach how CRISPR-Cas9 functions. वो कैसे कटिंग होगी, क्या होगा. That's a waste of time. मैं 2 डिजीजेस और पढ़ा दूंगा. मेरे को मतलब ऊपर से कि भाई ये डिजीज ऐसे होता है. Here you need a lot of breadth and conceptual understanding. I do not go into that technicality. कि कोई नया मेथड आया है, उस मेथड के एकदम unless it has got Nobel Prize. हमने नोबेल प्राइज में भी क्या बोला, बेस एडिटिंग समझाया कि बाय बेस एडिटिंग एमआरएनए का इन्फ्लेमेशन वाज रिड्यूस्ड. दैट वाज द एक्सटेंट दैट वी वेंट इनटू. वी डिडंट गो इनटू दोस टेक्निकलिटीज एंड वी डोंट हैव टू. फिर भी आप मुझे दिखा देना एग्जैक्टली क्या वर्डिंग्स है एंड क्या ऑप्शंस है. आई विल ट्राई टू डू इट. ओके, प्लीज अंडरस्टैंड दिस. You people are expected to know science tech only up till class 10. ठीक है? You're supposed to know science tech only up till class 10, not beyond that. And that is why the technical conceptual clarity that can be given to a student of up to class 10, that is what we need. We do not need ekdam. I may have used some formulas of class 11 and 12, but then I told you we don't have to remember it. हमें eventually remember क्या करना है? V is equal to V is inversely proportional to under root R. है ना? This is what we spoke about, and that is what we need to understand. That is what we need to do. Nothing else. Let's come back. Drugs. There are 2-3 things we'll do, and then we'll go to PYQs. Fentanyl ना अभी भी न्यूज में रहा है, बट मैं अभी उसे अपडेट नहीं कर पाया. बट what is fentanyl? Fentanyl is a synthetic opioid analgesic. अब ये टर्म तो आ गया, opioid analgesic, synthetic. First is it is synthetic. It is not coming from nature. It's synthetic. It is opioid. Opioid क्या होता है? These are drugs which are made from substances which are similar to what is found in opium poppy plant. तो opium में जो chemicals हैं, when synthetically we produce similar chemicals having similar property, we call them what? We call them opioid. पहला. दूसरा, it is analgesic. It is used in anesthesia, like painkiller and this kind of situation. Mein, yeah, if you want to make someone sleep, you will be using fentanyl. But there's a very important aspect that fentanyl is more potent than morphine, 50 times more potent than heroin as an analgesic, and therefore iska medical use to is fine and that is allowed, that is okay. But drug makers, not the medical science wala drugs, the nashe wala drugs, the drug makers add it in the drugs to give, like, to make people feel high way easily, and that is why US is worried. That is why US has been concerned. Thousands of people die in US, around more than 50,000 people to be exact, die in US every year because of drug overdose. And abhi uski, because of US it was in news. So first of all, it is what? It is a synthetic opioid which is used as used in anesthesia to reduce pain and to make sure that people fall asleep and wo cheezein. And it is way more potent than morphine, and it is more potent than heroin also. Now, opioid, we understand what opioid is. Opioid includes fentanyl, oxycodone, morphine, codeine, heroin, etc. This is the part. Because it is so potent, it's so impactful, the normal drugs may not be giving you as strong impact quickly. So people illegally add fentanyl in their drugs to make it more saleable, to make it more attractive. But iska overdose, because it is more potent than rest of the drugs, so iska overdose can lead to death, coma, respiratory failure, and opioid endemic in USA में, मतलब we are saying कि US में drug overdose से a lot of people are dying, and primarily it's because of illicitly manufactured fentanyl or drugs जिसमें fentanyl illegally has been added. They realize कि people are consuming heroin or people are consuming other drugs, and in reality, to make it more impactful, fentanyl illegally has been added in it. What is the role of China in it? Studies have shown that this fentanyl is manufactured in various factories in China, and then it is exported to Mexico. US में directly export नहीं होता illegal. Where does it get exported? Mexico. And from Mexico it enters China. And that's why at the beginning of this year, USA was imposing tariff on China, Mexico as well as Canada for illegal entry of fentanyl from there. Okay. Now, I hope we understood what fentanyl is. It is a opioid. ओपीएम जैसा इंपैक्ट होगा. बट व्हाट इज ओपीएम? देखो, ओपीएम नेचुरली प्रोड्यूस होता है. इट इज द ड्राइड लेटेक्स. जैसे if you look at the seed, if you cut it open, then can you see this liquidy thing coming out? इसको ड्राई करोगे तो it is the dried latex from the seed of capsules of opium poppy. What is the name of the plant? Papaver somniferum. It is a species of flowering plant from which both opium as well as poppy seeds are derived, and it is used in painkillers. वैसे तो simple terms में it is used in painkillers, and it is also like opium is the thing जो जिससे heroin बनता है. Opium is also the thing which is added in other synthetic opioids to make it more impactful. क्या इंडिया में ओपियम कल्टीवेशन अलाउड है? तो यस, बट नॉट ऐसे कि कल अपना धनंजय जाके ओपियम का प्लांट लगा ले. इट्स रेगुलेटेड. You will see in India opium poppy cultivation is prohibited under section 8 of NDPS Act, but licit cultivation, not illicit cultivation. licit और illicit में एक आई का फर्क है, बट ध्यान से देखना है कि नहीं, दो आई और एल का भी फर्क है. तो licit cultivation of opium is carried out in India in selected tracts which are notified by central government. Those tracts are in Rajasthan, Madhya Pradesh, उत्तर प्रदेश एक्सेट्रा. मेडिसिनल पर्पसेस एंड बाकी सारे पर्पसेस के लिए इट इज यूज्ड. फिर होता है कोकेन. देखो, हीरोइन, जब हम ड्रग्स की बात करें तो हीरोइन समझे, हीरोइन किससे बन रहा है? ओपियम से ही बन रहा है. पॉपी सीड्स, ऑल दोस थिंग्स आर कमिंग फ्रॉम देयर. फेंटानिल इज एन ओपियोइड बट इट इज सिंथेटिकली प्रोड्यूस्ड. देन कम्स कोकेन. Cocaine is made from the leaves of coca plant. Coca plant is native to South America, and इसका भी medicinal use हो सकता है. Psychotropic drugs generally have medicinal use also, but it's more popular as recreational. Cocaine, when we hear cocaine, what do we assume? वो cocaine smuggling हो रहा होगा, villain होगा वो, है ना? Those are the kind of things that we assume. So it is used more as recreational drugs. As a street drug, it looks like a फाइन व्हाइट क्रिस्टल पाउडर. आपने मूवीज में हमने देखा होगा. आई एम होपिंग ओनली मूवीज में ही देखा होगा कि कोकेन का स्मगलिंग, या वो ऐसे स्मेल कर रहा है या टेस्ट करके कोकेन अच्छा है खराब है. दीज आर द काइंड ऑफ थिंग्स यू मस्ट हैव सीन इन मूवीज कि दे आर व्हाइट क्रिस्टल पाउडर. हाउ डज कोकेन अफेक्ट द ब्रेन? तो कोकेन increases the production of dopamine, and we know dopamine makes us feel good, and that is the reason why people who get addicted to it prefer to consume it regularly. But in long term, in short term, there can be happiness, mental alertness, hypersensitivity to sight, sound, touch, paranoia भी हो सकता है. But in long term, it can create problems. It can create addiction and other challenges. एक ना कॉन्सेप्ट है ब्लैक कोकेन का. तो देखो, कोकेन को ना डिटेक्ट करने के लिए लॉट ऑफ टूल्स वर डेवलप्ड ऑन एयरपोर्ट्स, ऑन ports and all. So some people tried to introduce cocaine in India as black cocaine, where cocaine was mixed with charcoal to avoid detection. So it was in news for that reason. So this was black cocaine. Last में cannabis. कितने लोगों ने ट्राई किया है? जो कॉलेज गए होंगे, जो इंजीनियर्स होंगे, स्टीरियोटाइप. मैं तो हूं इंजीनियर, मैंने तो ट्राई नहीं किया. तूने नहीं किया? तूने तो किया है पक्का. नाम क्या है तुम्हारा? लक्ष्य झूठ बोल रहा है. बता ही देते. यहाँ है, यूट्यूब पे जा रहा है. लक्ष्य के पेरेंट्स सुनो, लक्ष्य बोल रहा है, मैं बता ही देता, घर वाले थोड़ी सुन रहे हैं. तो अब तुम स्टीरियोटाइप कर रहे हो, मतलब कुछ भी, लाइक चलो, कोकेन, सॉरी कोकेन नहीं, ये कैनबिस या वीड, पॉट, मैरिजुआना, ऑल दिस कम्स फ्रॉम द सेम प्लांट, या इसे हिंदी में क्या बोलेंगे? गांजा। किसी ने प्लांट ग्रो किया ये? देखा है? कहाँ देखा है? बहुत बार देखा है। गांव में है, निकल जाते हैं अपने आप से। हाँ, इट नेचुरली अकर्स इन हिमालयस। नो, अकर्स, इट अकर्स, वो ग्रो होता है वहां पे, बट इसका कल्टीवेशन जैसे वो रेगुलेटेड है ना, इसके नहीं है, इट्स नॉट अलाउड, डोंट डू दैट। तो हाँ, अब देखो इसमें व्हाट इज द केमिकल विच गिव्स अस दैट हाई होने वाला फीलिंग? इट इज टेट्रा hydrocannabinol, THC. It is the main psychoactive component of the cannabis, which is one of the 483 compounds found in the plant. Situation क्या है इंडिया में? It is naturally occurring weed found throughout the Himalayan region. Yet its cultivation is banned under NDPS Act. Unlike opium, there has been no official policy to regulate its legal cultivation. Opium का हमने देखा, legal illicit cultivation is allowed. Allowed मतलब in the notified areas it is allowed. That's not the case with cannabis. But एक पायलट प्रोजेक्ट हिमाचल में शुरू हुआ है। खुशी सबसे ज्यादा सुबोध को इस बात से कि पायलट प्रोजेक्ट हिमाचल में शुरू हुआ है। किस चीज का? कि व्हाट कैन बी बेनिफिट ऑफ growing, because naturally in Himalayan region, is it occurring? Yes, it's occurring. तो it's part of Himalayan biodiversity. वहां पे it can be grown. So in the past it has been grown for fiber, seed, biomass and other dual purposes. So it can be grown for that purpose and it can also lead to improved livelihood opportunities, and that is why ये भी थोड़ा सा न्यूज में रहा है कि should this be allowed, should this be continued, what can be its implication. But ये सारे टर्म्स ये या तो बायोडाइवर्सिटी के पर्सपेक्टिव से पढ़ लो या साइंस के पर्सपेक्टिव से, विच इज द केमिकल, विच इज द प्राइमरी साइकोएक्टिव सब्सटेंस हियर, इस वाले पर्सपेक्टिव से पढ़ लो। लास्ट में वी हैव ओनली टू टॉपिक्स। एक तो जस्ट रीड अबाउट लैंसेट अ बिट, वी हैव जेनरिक मेडिसिन एंड वी हैव फिक्स्ड ड्रग कॉम्बिनेशन। इन दोनों को फटाफट पढ़ लेते हैं बिफोर वी जंप इनटू सॉल्विंग क्वेश्चंस। देखो, लेट्स से there's a company, there's a pharmaceutical company, let me call it American Medical Company 1, and it manufactures or it invents a new chemical. It creates a new chemical. Let me call it chemical 1. It creates a new chemical called chemical 1, and using it, it is manufacturing a medicine. Let me give a brand name to medicine कि इसका नाम है AMC Med. AMC Med is the name of the medicine. जैसे आप डोलो खा रहे हो ना, डोलो इज द नेम, उसमें है क्या? पैरासिटामोल। पैरासिटामोल इज द केमिकल, डोलो इज द ब्रांड नेम, एंड डोलो में बी मैन्युफैक्चर्ड बाय अ कंपनी। वो मेरे लिए यहां पे व्हाट इज दैट? अमेरिकन मेडिकल कंपनी AMC 1। अब समझते हैं, देखो, इनिशियली फॉर 20 years they will have patent over it, and no one else can manufacture it, or they can manufacture it only after taking license from them, right? But after 20 years their patent over Chem 1 would go away, and other companies will also be able to manufacture Chem 1. So let's say रेड्डी लेबोरेटरी, क्या नाम है? डॉक्टर रेड्डीज, डॉक्टर रेड्डीज manufacture the same Chem 1 and brands it as, after 20 years, not before that, and brands it as Redmed. What is the name of the medicine? Redmed. And then there's a generic medicine manufacturing company Can it also manufacture it? It manufactures it, but it sells it in the name of Chem1 only. Ab, let's understand. देखो, this was a branded medicine. What was its brand name? AMC Med. After the patent period is over, now anyone can use this Chem1 even without taking permission from the American medical company. This medicine is generic, but this is also branded generic. Is Dr. Reddy's selling it in the name of Chem1? No, Dr. Reddy's is selling their product in the name of Redmed. What is the brand name in which this medicine is being sold? Redmed. This was branded. This is branded generic, and this one is generic medicine. What medicine is this? This is generic medicine. Did we understand the difference between branded? Once the patent time is over, any other company can manufacture it and sell it under its brand. That is branded generic, and then we have generic. हमारे खेत में देखा है बेटा, ये ना जेल वेल मत जाना, पता लगे आईएएस बनने से पहले तुम पूरा लॉ पढ़ लिए हो, वो मत करना. ये did we understand what is this? Now, generic medicines have certain advantages. Say the person who is manufacturing this medicine, they have not spent a lot of money on R&D. So for them, the cost of this medicine is very less. It can be sold at very low prices, and it can reduce the health expenses in India. But at the same time, it is the same medicine. Chemically, it is same. अब आप सोडियम क्लोराइड इंडिया में खाओ या सोडियम क्लोराइड यूएस में खाओ, सोडियम क्लोराइड इज सोडियम क्लोराइड. तो chemically, it's exactly the same. In terms of how it will be delivered to your body, it is also the same. Only it is not sold under the name of some brand, and it will lead to cheaper alternatives. This is generic medicine. Government of India has been trying to promote it. There's an initiative also. What is the name of the initiative? Jan Aushadhi Kendra. Government is subsidizing throughout the country opening up of Jan Aushadhi Kendra. Northeast India में SCs को, STs को, इन सबको ज्यादा support मिल रहा है for opening Jan Aushadhi Kendra, where these generic medicines would be available. But some people also raise concerns like doctors say that we trust Dr. Reddy, we don't trust this particular company. Now, as I gave you an example, ki sodium chloride we are consuming in India or sodium chloride we are consuming in US, chemically they are same, agreed. But when you consume Tata salt, you have trust on the quality of salt. But when you consume, let's say, Dhananjay salt, DJ salt, you don't know how this company functions, whether they follow the hygiene levels or not. So, as a seller, as a recommender, जब मेरे से कोई पूछे कि salt कौन सा ले, मैंने कहा टाटा ले ले. If something goes wrong, I may be questioned also. But I'm asking you sodium chloride ले ले, and then you are buying it from anywhere, no matter पता नहीं कौन सा brand है, whether it's fake or not, वो सारे issues हैं. So that's why doctors have been थोड़ा सा worried कि patient doctor का जो trust होता है, that's based on doctor telling the patient कि this is the medicine you should take. If doctor is just telling कि ये chemical ले लो और वो आप कोई भी ले रहे हो पता नहीं it's effective or not, then India में regulatory framework कि are generic medicine manufacturing company really following all the regulations, are they of good quality, वो concerns आते हैं. So for this reason, there are some limitations in introducing them. Then accessibility is a concern. While we say that so many Jan Aushadhi Kendras have been opened, but अभी भी आप यहाँ से राजेंद्र प्लेस मेट्रो स्टेशन तक जाओगे, on the right side, on the left side at least, you'll find many shops of many normal medical store. जन औषधि केंद्र है एक अंदर कोने में जाके, हाँ पीछे साइड में जाके. तो accessibility is still a challenge. तो ये issues है. Are we getting this? Pakka? Is everyone able to understand what? बाकी ना all other things are वो factual storytelling जो which we should know, and that's why you can read it there. एक और चीज पढ़ लेते हैं. A fixed drug combination. Now देखो, I had अभी viral fever last Tuesday से like till yesterday थोड़ा सा तबीयत खराब था मेरा, and I was given some medicines. Now medicines में ना एक ऑप्शन ये था कि they'll give me 5 different medicines and 5 of them have salt 1, salt, this will have salt 2, salt 3, salt 4, salt 5, salt 6. This is, let's say, 500 mg of paracetamol. This is 50 mg of something else. This is 5 mg of something else, and so these medicines can be given to me, or a single tablet can be made out of it, which has 500 mg of paracetamol, 50 mg of salt 2, 5 mg of salt 3, 1 mg of salt 4. So this is fixed drug combination. This is fixed drug combination. Did you understand what FDC is? Now FDC has an advantage. देखो, तो अगर FDC has been rational, it has several advantages. One, for a normal person understanding 6 different medicines कौन सी कितनी खानी है, this can be a challenging. But if only one tablet has to be eaten, that's easy. It can be eaten, वो कभी भी अपने बैग से निकालेगा, वो tablet खा लेगा, that's done. So it is easy to follow, it is easy to understand. Manufacturing, it is cheaper also. When you will buy 6 different tablets separately, they'll all be packaged separately, they'll all be branded separately, they'll all be transported separately. वो expensive भी होगा, but FDCs could be otherwise beneficial. So FDCs have advantages, and WHO has approved several FDCs. But then there can be irrational FDCs. What is irrational FDCs? आप ना, like, some things are not needed in combination. Yeah, you don't need all of it. ये salt सही है भी नहीं, फिर भी you are being recommended this FDC. Or they've just added these two salts to for patent purpose कि no one should be able to copy this medicine, and so on. Those are irrational FDC. Irrational FDC may lead to overconsumption of medicines, irrational use of medicines, antibiotic resistance. जहां antibiotic नहीं चाहिए वहां भी खा रहे हैं. तो India is the center of this irrational FDCs. There are, like, regulatory framework is weak, and a lot of FDCs directly or indirectly is there in the market. WHO ने जितने FDCs आज तक पूरे अप्रूव किए हैं, उससे 10 टाइम ज्यादा FDCs इंडिया में मिलते हैं. India's medicine manufacturing regulatory bodies are not able to handle it properly. Government, it keeps on coming in news, but because government keeps on banning several FDCs. जैसे last year only some very famous FDCs which people had been regularly taking. जैसे एक चेस्टोन करके था, which people used to consume regularly, it was banned. जैसे in August 2024, 156 FDCs were banned, terming them irrational and without any therapeutic benefit. This included popular drugs like Cheston Cold, Foracet, which are used for cold and fever and pain respectively. I hope हमें समझ में आया what FDCs are, what fixed drug combinations are. Generic medicines, fixed drug combination, both are understood. Yes. I don't think so. मतलब मल्टीविटामिन्स जो जैसे जिसमें मल्टीपल विटामिन्स होते हैं, विल दे बी कंसिडर्ड एफडीसीज? वो ना न्यूट्रिएंट सप्लीमेंट होते हैं, तो आई डोंट थिंक, आई एज फार एज आई अंडरस्टैंड, दे शुड नॉट बी कंसिडर्ड एफडीसीज. सॉरी, नहीं आएंगे, रेगुलेट होंगे, बट क्या लिखा रहता है? हाँ, अगर सप्लीमेंट्स की तरह है तो ऐसे बिना मतलब यू मे टेक सम मल्टीविटामिन्स इवन विदाउट रिकमेंडेशन ऑफ अ डॉक्टर, ऐसा भी होता है. सम आर इजीली, जैसे रिवाइटल तो कोई भी वहां से खरीद के खा लेता है, इट हैज मेनी विटामिन्स, तो राइट. ओके, तो these are some of the topics. अभी मैं और भी, like till April I will keep updating it, current affairs. I'll keep going through all the sources and I'll keep adding everything in health here only. आप बस what you do is you keep on revising. आप पढ़ो, समझो, सबके बारे में awareness रखो and ensure that things which are there in notes you are not going to make those wrong. I'll ensure that you people are amongst the best prepared people. Okay, अभी PYQs करते हैं. Is to health. Yes, बेटा. हाँ. हाँ. देखो न्यूज में होगा तो मैं आज करवा दूंगा. डोंट वरी. ओके, कम है. वे स्टार्टिंग वही 1995 के PYQ से स्टार्ट कर रहे हैं. Living organisms require at least 27 elements, of which 15 are metals. Among these, those required in major quantities include. तो देखो, at least 27 elements. Elements में generally minerals and all those stuff are needed. Some of the 15 of them are metals. Among these, which are required in major quantity. देखो, we had studied trace minerals and major minerals. And major minerals में अपन ने क्या पढ़ा था? सोडियम, पोटेशियम, क्लोरीन, कैल्शियम, है ना. सोडियम था तो सोडियम क्लोराइड, तो क्लोरीन भी होगा. these were some of the things जो हम कॉमन सेंस से याद कर पा रहे हैं. तो देखते हैं. एक look at आराम से, मतलब और ना, rather than trying to remember everything, apply your logic, apply your common sense. It's very important. We will learn the use of common sense while solving these questions, rather than हर चीज ना याद करके लिखी है. नहीं, याद रखेगी तो अच्छी बात है. But even if we don't remember it right now, rather than looking at your notes, try to do what? Try to solve this. Why not one? What is wrong in one? Molybdenum, है ना. Potassium, copper, wopper, हम इतनी ज्यादा quantity. Copper is needed. Copper, yeah, iron. They are trace minerals. They are needed in much smaller quantity. C में everything is there. Potassium, magnesium chloride, calcium chloride, sodium chloride, potassium chloride. These salts may be needed in larger quantity. यहाँ पे भी डी में भी कॉपर आ गया. कॉपर इज अ मेटल. वी कंज्यूम इट इन वेरी वेरी स्मॉल क्वांटिटीज. वो हमें दिखता भी नहीं है. इज इट मेकिंग सेंस? व्हाट इज द आंसर फॉर दिस? सी. ओके. ओके, रुको यार, पढ़ने तो दो, मुझे तो पढ़ने दो, बाकियों को मत पढ़ने दो. आयोडीन, थायरोक्सिन, राइट. इजी वन. ओके, क्वेश्चन नंबर 2 में ए. इजी. देखो, सबसे पहले नहीं, सही आंसर करना है. जिसने सबसे पहले आंसर किया और गलत किया, वो मुर्गा बनेगा यहाँ के. ठीक है. डायबिटीज. ए. डी. हाई शुगर लेवल इन ब्लड तो डायबिटीज है, ठीक है. लो शुगर लेवल, वो डायबिटीज थोड़ी है. लोअर इंसुलिन लेवल, यस. लो इंसुलिन कैन आल्सो बी अ सिचुएशन ऑफ डायबिटीज. आपकी बॉडी लो इंसुलिन प्रोड्यूस कर रही है, दैट इज सिचुएशन ऑफ डायबिटीज, राइट. तो 1 and 3 आई गेस. हायर इंसुलिन नहीं, लोअर इंसुलिन लेवल, राइट. तो 1 and 3, 1 and 3 तो डी होना चाहिए. क्वेश्चन नंबर 3 डी. इज एवरीवन कंफर्टेबल विद दिस? ओके, आराम से, मतलब किसने बोला? इसने बोला? तुमने बोला? पहले बेसिस है. कॉन्फिडेंस रखो. बी. एड्स, सेक्सुअल इंटरकोर्स बाय ब्लड ट्रांसफ्यूजन. by mosquito and other blood sucking insect across the placenta. मॉस्किटो से तो एड्स नहीं होता ना, वरना तो एड्स वाले पेशेंट आपके दोस्त रहते हैं तो दिक्कत नहीं। हमने कहा एड्स वाले पेशेंट से आप हाथ मिला सकते हो, किस कर सकते हो, सच, अरे खाना खा सकते हो, हग कर सकते हो, उससे एड्स नहीं फैलता, राइट। तो पर अगर वो आप आपका दोस्त है, उसे मॉस्किटो काट रहा है, आपको काट रहा है, फैल जाए तो गड़बड़ हो जाएगी, फिर यू विल ट्राई टू स्टे अवे फ्रॉम दैट पर्सन, राइट, बट दैट्स नॉट नीडेड बिकॉज मॉस्किटोज कैन नॉट स्प्रेड एड्स। तो 1, 2 and 4, राइट। हाँ हाँ, तब भी राइट डाउन व्हाई मॉस्किटोज कैन नॉट स्प्रेड एड्स। मॉस्किटोज लैक T cells. Mosquitoes lack biologically why mosquitoes cannot spread it. Mosquitoes lack T cells that HIV needs to latch onto and reproduce. Mosquito lack T cells. Mosquito lack T cells that HIV needs to latch and reproduce. Without this, HIV gets digested into mosquito's gut. HIV is not able to multiply inside mosquito, it just gets digested in the mosquito's gut. Mosquito's stomach, like stomach is not the organ there, but in mosquito's gut it gets digested. दूसरा है, you have to understand कि mosquito injects saliva while feeding, not blood from a previous person. HIV isn't transmitted through saliva. है ना, एक ये भी रीजन होता है, बट इतना जानने की जरूरत है नहीं. Mosquitoes do not spread AIDS, we know that, no, that should be good enough. I'm trying to give you a reason because she asked कि मॉस्किटो खून पी ले रहा है उसके बाद भी तो नहीं फैलेगा, बट इट डजंट मीन दैट यू विल स्टार्ट डूइंग दिस. सिरिंज लेके चले गए, वहां से फैल जाएगा, है ना, बिकॉज वो ब्लड डायरेक्टली जा रहा है, फ्रॉम देयर इट कैन स्प्रेड, तो सिरिंजेस कैन स्प्रेड इट. ओके, तो व्हाट इज द आंसर हियर? बी, 1, 2 and 4. ओके, क्वेश्चन नंबर 4 का आंसर बी है. लेट्स गो टू 5. यार मुझे ही नहीं अटेम्प्ट करने दे रहे हो तुम. माल नरिशमेंट, ओवर न्यूट्रिशन, अंडर न्यूट्रिशन, इम्बैलेंस न्यूट्रिशन. व्हाट इज माल नरिशमेंट? देखो, मैल का मतलब होता है खराब. क्या ओवर न्यूट्रिशन खराब है? अंडर भी और इम्बैलेंस भी, राइट. तो ऑल. क्वेश्चन नंबर 5 का डी, 5 में डी. लेट्स गो टू क्वेश्चन नंबर 6. एंटीजन, एंटीजन के रिस्पॉन्स में एंटीबॉडी बनता है, एंटीजन के रिस्पॉन्स में एंटीबॉडी बनता है. तो व्हाट इज एंटीजन? ट्रिगर्स द इम्यून रिस्पॉन्स, है ना. इन केस ऑफ कोविड-19 द स्पाइक प्रोटीन वाज द एंटीजन, इट ट्रिगर्स द इम्यून रिस्पॉन्स, राइट. एंटीजन एंटीबॉडी इंटरेक्शन से वी कैन आल्सो डिटेक्ट वेदर अ डिजीज इज देयर और नॉट. कोविड इन्फेक्शन हम एंटीबॉडीज के प्रेजेंट की वजह से भी देख लेते हैं ना, द एलिसा मेथड, राइट. तो सी आंसर, क्वेश्चन नंबर 6 का सी. इज एवरीवन कंफर्टेबल विद दिस? ओके, आराम से यार, मुझे भी तो पढ़ने दो यार. कौन से टेस्ट में? सारे? हाँ तो ठीक है, कामचोर लोग बनाते नहीं नए सवाल, ये डाल देते. कंजम्पशन ऑफ फिश इज कंसिडर्ड टू बी हेल्दी व्हेन कंपेयर्ड टू फ्लेश ऑफ अदर एनिमल्स बिकॉज फिश कंटेन्स, हाँ, पॉलीसैचुरेटेड फैटी एसिड. फिश में कार्बोहाइड्रेट तो नहीं होता, है ना. ऐसे ही फिश में सैचुरेटेड फैटी एसिड होता तो इट वुड हैव बीन अनहेल्दी, राइट. पॉली, वी हैव स्टडीड फिश ऑयल, हमने पढ़ा है. प्लीज अंडरस्टैंड, आपको ना उस टाइम पढ़ते टाइम ऐसा लग रहा होगा कि यार क्यों पढ़ा रहे हैं, फैट वैट है, ऐसा ऐसा कभी कुछ कुछ फील आ रहा होगा किसी को. बट when you analyze PYQs you realize कि उन areas से in the past questions have been asked. So not a single topic that you have studied, there are more topics that I want to teach, I haven't taught them to control my urge की नहीं ज्यादा नहीं पढ़ाना है. There are many more topics, right? तो this is important. वो फैट वाला वो सारा टॉपिक आप ध्यान से पढ़ेंगे. Okay, तो आंसर should be A. Yes. Beta, like why when compared to others they have more vitamins? When we talk about vitamins की जब हम बात करते हैं, what are the major sources? हम जनरली फ्रूट्स की बात करते हैं. विटामिन सी यहां से मिलेगा, विटामिन ए से. ओनली फॉर विटामिन B12 वी थिंक ऑफ मटन, राइट? हमने फिश तो कभी नहीं सुना. तो व्हाट इज द आंसर फॉर 7? A. 8. Easy. देखो, we may not have studied all these diseases, but जितना पढ़ा है उससे we'll try to do it. Malaria is caused by protozoa, Plasmodium. A should be 4. We are left with only A and B option. Polio is caused by virus. B should be 3. अच्छा, दोनों में वही है. TB is caused by a bacteria. C2. Done. है ना? तो ringworm D1. ठीक है. अब we don't know, we haven't studied this, but still we'll be able to answer it. समझ में आ रहा है? तो घबराना नहीं है कि यार फंगल डिजीज नहीं पढ़ा. मतलब use whatever you know, apply your all the knowledge and try to answer it. What is the answer here? 8th में A. Okay. 9th, hemophilia, non-clotting of blood. Hemophilia A, B, it was non-clotting. Factor 8, factor 9. देखो न्यूज में भी है, बट ये when was this asked? 1998. पैदा नहीं हुए थे आप में से आधे. समझे? पैदा हुए थे, मम्मी पापा की शादी भी नहीं हुई होगी. हो गई थी. ओके ओके ओके, कहीं ओके हो गई थी. तो 9th में डी. मेकिंग सेंस? ओके. 10. Unsaturated fats are more reactive compared to saturated fats. Unsaturated fats have only single bonds. नहीं नहीं, वो तो सैचुरेटेड में होता है ना सिंगल बॉन्ड्स. अनसैचुरेटेड तो हैव डबल बॉन्ड्स. तो R is wrong. R is wrong में we are left with only C. Okay, okay. 11. Probiotic. है? इतनी जल्दी बेटा पढ़ लो थोड़ा. एक सेकंड दे मुझे. Probiotic food contains live bacteria which are considered beneficial to health. Probiotics में that's what we take. Probiotic food help in maintaining gut flora. Gut में we have good bacteria, bad bacteria. Sometimes when loose motions occur, food poisoning occur, तो what increases there? Bad bacteria increase there. या फिर sometimes when you are consuming antibiotics, तो antibiotics may kill good bacteria also. So at that time, what you are recommended? Probiotic food. Now, probiotic so that good bacteria can again become more in your stomach. 400. Oh, 11th में answer is C. C for cat. 12. है? सब तेज बच्चे आ गए मेरे पास. Regular intake of fresh fruits and vegetables is recommended. Antioxidants, they're good source of antioxidants. How do antioxidants help a person maintain health and promote longevity? ये है ना? Okay, tell me. They activate the enzymes necessary for vitamin synthesis in both body. They prevent excessive oxidative carbohydrate. They neutralize the free antioxidants. Oxidants को counter करना, है ना? They neutralize the free radicals produced in the body during metabolism. Right? This should be the answer. तो whenever you are consuming food, whenever food का metabolism हो रहा है, you're running, तो when metabolism is taking place in your body, there are free radicals produced. Those free radicals, if not treated properly, may harm you. And antioxidants are supposed to fight those free radicals effectively, counter those free radicals effectively. अभी मैं इनके बारे में कुछ लिखवा दूंगा आपको, डोंट वरी. तो अभी के लिए what is the answer for this question? C. 12th के लिए आंसर is C. Let's go to 13. Let's go to 13. 13, let online students answer this. ऑनलाइन बच्चों, गट फ्लोरा. बेटा गट फ्लोरा जो आपके गट की जो बायोडाइवर्सिटी है ना, उसे गट फ्लोरा बोल रहे हैं. ओके, 13 ऑनलाइन स्टूडेंट्स. बताइए. इट्स इजी वन. जितना आता है उतना कॉमन सेंस यूज करेंगे, उससे यू विल बी एबल टू डू इट. ए, बी, सी. अच्छा देखो, पहले थर्ड स्टेटमेंट देखते हैं. वायरसेस आर ट्रांसमिटेड फ्रॉम वन ऑर्गेनिज्म टू अनदर बाय बायोलॉजिकल वेक्टर्स ओनली. हम खांसते हैं तो क्या हवा से ट्रांसफर हो जाता है वायरस? कोविड, क्या वहां पे बायोलॉजिकल वेक्टर वाज नीडेड? वाज सम मॉस्किटो नीडेड? नहीं ना यार. कोविड में वाज मॉस्किटो नीडेड, वाज एनीथिंग एल्स नीडेड? आप खांसते थे, सामने वाला सूंघता था. थ्रू एयर इट गॉट ट्रांसमिटेड, और यू स्नीज समवेयर, यू टच्ड समवेयर, समवन एल्स टच देयर, और वो उसने ऐसे कर लिया. वाज द वायरस गेटिंग ट्रांसमिटेड? वाज एनी बायोलॉजिकल वेक्टर नीडेड देयर? नहीं ना. ध्यान से करते. थर्ड इज रॉन्ग, यू गेट योर आंसर. Isn't it? If एक मैं 1 और 2 बताता हूं, पर पहले तो आंसर निकालना है ना. विल अंडरस्टैंड एवरीथिंग, बट ऑलवेज फोकस कि आपने क्या पढ़ा है. लेट्स यूज दैट टू गेट एन आंसर. विल ऑल ऑफ लाइक यहां पे ना, एवरी स्टूडेंट जो कि वैसा भी है ना, जिसने प्रिपरेशन नहीं किया एंड इज जनरली अवेयर, वुड नॉट नो मेनी बैक्टीरिया बट वुड नो कोविड, एंड वुड नो कि कोविड में कोई biological vector was not needed. So this statement, viruses are transmitted from one organism to another by biological vectors only, this is a extreme statement. अपन measles का transfer, measles is very contagious. Did we need a biological vector for that? No. Ebola is very contagious. Did we need a biological vector for that? No. इतने सारे diseases पढ़े हैं, exactly वो सवाल नहीं आएगा. I'm saying general awareness that you will build, that will be asked in the examination. So 3 for sure is wrong. Make sense? Okay. First statement 1. Viruses lack enzyme necessary for generation of energy. Yes, that is why they can only reproduce, they can multiply where? In some other cells. They don't have enzymes for energy production. That is true. They have RNA जो replicate करते हैं by when they enter some other cell. Second, viruses can be cultured in the synthetic medium. देखो, viruses can multiply within a cell, no? Synthetic medium में कैसे कर पाएंगे? तो 2 is cultured in synthetic medium. 2 is wrong, ना? Yes. Synthetic means living या biological medium नहीं होना चाहिए. Like you provide salt, you provide sugar, but क्या नहीं होना चाहिए? Life नहीं होनी चाहिए वहां पे. तो but viruses को multiply होने के लिए do they need to enter a cell? तो statement 1 and 2 are correlated. Viruses lack enzyme necessary for generation of energy, and thus in a synthetic medium, just by giving it energy, it will not be able to multiply because they do not have the right enzymes. They need to depend on other cells. They will depend on other cells for energy production. There they will consume that energy and would multiply. Make sense? What is the answer here? A. What were online students? They were mostly saying A. 13th में. 14. आराम से, जल्दी नहीं करनी है, सही करना है. Contraction of muscles, ये तो अजीब सा हो गया. अब इसमें विल यूज कॉमन सेंस, उससे अटेम्प्ट करेंगे. आई कैन नॉट डू दिस की फॉर एवरी पर्पस देखने के लिए कौन कौन से मिनरल्स यूज हो रहे हैं, वी कैन नॉट डू दैट. बट थोड़ा सा शांति से यूज योर कॉमन सेंस एंड ट्राई टू आंसर दिस. देखो, कॉन्ट्रैक्शन ऑफ मसल इज अ वेरी बिग मूवमेंट. नहीं है ऐसा? तो क्या इसमें आपका ब्लड फ्लो हो रहा होगा जो एनर्जी सप्लाई कर रहा होगा? योर बोन्स वुड बी इन्वॉल्व, है ना? प्लस यू वुड नोटिस दैट व्हेन दिस हैपेंस, sometimes if you're training, if you're going to gym, your gym trainer may ask you कि सर वो ना वो लेते रहो, आप मिनरल्स लेते रहो. They'll ask you to do that because as you lose your minerals, your ability to strengthen your muscles go away. आपको क्रैम्प्स आ जाएंगे बहुत इजीली. When there is less minerals in your body, you can face cramps. So वैसे all three of them are correct, but again, this is not something that I was expecting myself कि मैं इसे prepare कराऊंगा. I'll go into the details of each of the key for every body movement which are the minerals required. It's not rational कि हम वो चीजें कर पाएंगे. Here all of them are used. Okay. तो आंसर इज डी. आंसर इज डी. 2013 में आंसर इज डी. 2013 का क्वेश्चन नंबर 14 आंसर इज डी. 15. Which of the following diseases can be transmitted from one person to another through tattooing? Tattooing में pins can are used. Blood इधर से उधर जा सकता है. तो HIV एड्स तो ऐसे स्प्रेड होता है. हेपेटाइटिस भी स्प्रेड होता है. Why not चिकनगुनिया? मॉस्किटोज. बट हमने कभी पढ़ा नहीं कि डेंगू पेशेंट को ऐसे करके वो हो जाता है, या चिकनगुनिया को. दिल नीड अ बायोलॉजिकल वेक्टर. यस. तो बी. बी 404 का बी. ओ सॉरी, क्वेश्चन नंबर 15 का बी. क्वेश्चन नंबर 16. हाउ मेनी ऑफ देम आर इरेडिकेटेड फ्रॉम इंडिया? चिकन पॉक्स तो अभी भी होता रहता है आपको, तो 2 डेफिनेटली इज नॉट इरेडिकेटेड. तो बी और डी बचता है. स्मॉल पॉक्स हैज बीन इरेडिकेटेड, तो 3. हाँ, तो बी बचता है. डिप्थीरिया के लिए अभी भी आपको वैक्सीनेशन मिलता है, राइट? व्हाट इज द आंसर? बी. स्मॉल पॉक्स हैज बीन इरेडिकेटेड. क्वेश्चन नंबर 16 बी. 16 में बी. लेट्स गो टू 17. H1N1 swine flu, and please note H1N1 was also what? Spanish flu. याद है? The big pandemic caused in 1919. It was Spanish flu. It was also H1N1, है ना? देखो, अब H1N1 स्वाइन फ्लू है, वो तो सबने प्रिपेयर कर लिया होगा PYQ देख के. You have read a bit more. You should be a step ahead. आपको H1N1 के साथ स्पेनिश फ्लू भी आ रहा है. चांसेस दैट स्पेनिश फ्लू पे क्वेश्चन आएगा कम है, बट द पॉइंट इज बिकॉज वन पैंडेमिक हैज जस्ट गॉन, दे मे वांट टू देखते इसे और कितना आता है इन पैंडेमिक्स के बारे में. द पैंडेमिक ऑफ 1918 1919 which killed these many millions people was caused by which of the following viruses? Most of the students who have not prepared it will say यार H1N1 तो नहीं है क्योंकि इससे तो स्वाइन फ्लू होता है, isn't it? If we have not studied it, that is what we'll say. H1N1 should not be there. It is causing swine flu. It is something recent. But H1N1 only is causing Spanish flu also. Make sense? 17 में what is the answer? D. D. D for dog. 18. Which of the following viruses can infect? सबको virus can infect any cell, है ना? We haven't said कि virus will not be able to infect this cell or that. लिविंग सेल चाहिए, वायरस इन्फेक्ट कर देगा. तो सी नहीं, डी. डी. डी फॉर डॉग, राइट? ओके. 18 में डी. मिशन इंद्रधनुष. इजी वन. ओके ओके. 20. In tropical region, Zika virus disease is transmitted with same mosquito that transmit dengue. Aedes mosquito पढ़ा है अपन ने? And Aedes mosquito, so we have studied 4 diseases with Aedes mosquito: dengue, Zika, yellow fever, chikungunya. Right? पूछे हम, we are a step ahead. Not only PYQs. Right? Sexual transmission of Zika virus is possible. Yes. Sexual, हाँ, is possible. हमें notes में भी है. देखो, प्लेसेंटा से चाइल्ड को जाता था जीका. Generally, the diseases which can spread like this also have sexual transmission possible. So, what is the answer? C is the answer. 20 में C. 21. Which of the following statement is not correct? Please note, not correct पूछा है. Hepatitis B virus is transmitted much like HIV. तो सही है ना? Hepatitis B, unlike C, does not have a vaccine. Wrong. Hepatitis B has a vaccine. It is included in universal immunization program. तो वैसे तो answer we got B, but let's look at C and D also. Globally, the number of people infected with hepatitis B and C are several times more than those infected with HIV. बहुत सारे हैं, like B और C. इंडिया में इतने सारे लोग infected हैं. Some of those infected with hepatitis B and C viruses do not show the symptoms for many years. That's also true. No, it's the case with almost any disease. Some of the people will not. COVID के लिए भी some of the people will not show any symptoms. So what is the answer? वैसे for sure we knew कि B is wrong. Hepatitis B has a vaccination. 21 में B. Let's go to 22. Multi-drug resistance in microbial pathogens in India. अपन ने पढ़ा ना drug resistance? Notes में नहीं है, but I explained you. D. Okay. D2. Multi-drug resistance in microbial pathogens. Like TB virus का drug resistance क्यों होगा? Genetic predisposition of some people. अब लोगों के genetic predisposition से बैक्टीरिया क्यों? Which are the following reasons for occurring of multi-drug resistance in microbial pathogens? Like why TB bacteria will become MDR? Not because of genetic predisposition of some people. It has no relation there. No? So one for sure should be wrong. Now we are left with B and D. Okay. Taking incorrect doses of antibiotic to cure disease. 2 should be there. वो तो दोनों में है. अच्छा 4 को देखते हैं खाली. Multiple chronic diseases in some people. Can it lead to antimicrobial resistance? देखो, multiple chronic disease would mean you are taking multiple medicines. More medicines you take, less chance. नहीं, same medicine बार बार लोगे तो problem है. Do you remember? TB में we were giving 4 antibiotics. So that why were we giving 4 antibiotics? So that chance of development of drug resistance reduce. नहीं, एक समझाते हैं. देखो, suppose these are the 4 antibiotics that you are giving. Different, because you suffered from different diseases, different antibiotics was given. And think of this as pathogen. This antibiotic, let's say, kill almost all of it. Only 0.01% was left. But because you're taking some other antibiotic also, these are resistant to this antibiotic. But these are not resistant to this antibiotic, no? There are chances that they'll get killed. So when you have more, अगर same medicine ज़्यादा लोगे, तो, but when you're taking multiple medicines, in TB we give 4 medicines, so that chance of drug resistance reduces. नहीं समझ में आया? हाँ, तो क्या हुआ? हाँ, I agree, but ना multiple है. देखो, यहाँ पे ना they're not saying using antibiotic. नहीं, कहाँ पे क्वेश्चन? Multiple chronic diseases in some people. In some people, multiple chronic diseases. Multiple diseases होना. No. Taking multiple antibiotics reduce the chance of development of antibiotic resistance. ये तो समझा रहा हूं. देखो, TB bacteria could have been killed by only one antibiotic. why in the first round of TB we take 4 antibiotics? So that जो पहले एंटीबायोटिक से जो बच भी जाए bacteria, second antibiotic is able to kill that, even if something survives, third is able, so that chance of resistance would occur when, like, let's say all of us, someone is trying to kill all of us, some chemical has been put, but she survives. In the next generation, will these genes be more? Tabhi she is resistant, or the next population will be resistant. But suppose first some toxin was released, almost all of us were killed, and then but she was saved. She had gene which protected her from first toxin, but she not necessarily have gene which will protect her from the second toxin. When the second toxin comes, she is also gone. If we were only using first medicine, then in sometimes इनके genes would have spread more and the system would have become resistant. Am I making sense? अगर नहीं तो मैं दोबारा बताऊंगा बोर्ड पे, बताओ मुझे समझ में नहीं आया. Has everyone understood this? Sure? Okay. एक बार यूपीएससी का आंसर की देख लेते हैं ना, एक बार वो देख लेंगे, ठीक है. लेट्स कम हियर. 23 पे आते हैं. तो which are the following are reasons for occurrence of multi drug resistant? हाँ तो बी तो होगा ना, 4 नहीं होगा ना. बी आंसर है ना, मैं भी तो वही बोल रहा हूं. The question number 21 में I'm saying 4 will not be leading to multi drug resistant development. So what, 1 will not be leading to it, 4 will not be leading to it. What will be leading to it? 2 and 3. B is the answer. Okay. 23. A company market food products advertise that its items don't contain trans fat. Trans fat is the first type of fat that we hydrogenated fat. What does the campaign signify to consumers? The food products are not made out of hydrogenated oils. हाँ, is it? Well, देखो, question is, what does the campaign signify to consumers? हाँ, first is there, है ना, hydrogenated oil से नहीं है, ठीक है. The food products are not made out of animal fat. नहीं नहीं, ऐसा तो नहीं बोला, है ना. Animal fat can be non-trans fat also. So 2 is not there. The oil used are not likely to damage cardiovascular health of customers. Yes. When they're saying it is trans fat free, trans fat would have damaged cardiovascular, so it is less likely to damage cardiovascular health of the customers. That's also true. So I think 1 and 3 should be there. C should be the answer. Is everyone understanding this? अरे मना करते पर इस स्टेट में, ये जब मैं बोल रहा हूँ ट्रांस फैट नहीं है मेरे खाने में, इससे बाय एनी वे आई एम सेइंग कि एनिमल फैट नहीं है. हाँ, वो तो अलग से बोलेंगे ना, देयर इज नो एनिमल फैट हियर, तब इट वुड मीन दैट. व्हेन आई से ये मैंने फ्राई किए हैं चिकन मोमोज इन ऑयल विच इज नॉट ट्रांस फैट, आई एम सेइंग कि इसमें कोई एनिमल, मैंने यही बोला ना, ट्रांस फैट नहीं है इसमें, है ना. तो व्हाट इज द आंसर? सी. 23 में सी इज द आंसर. ओके. 24 ACE2. रिमेंबर ACE2 विच क्या इससे अटैच होता है? स्पाइक प्रोटीन, है ना. स्पाइक प्रोटीन पे एक रिसेप्टर एक्सेप्टेंस डोमेन है, इट गोज थ्रू ACE2, इट एंटर्स द सेल, राइट. तो व्हाट इज द आंसर हियर? डी. अब पता है ये इतने डिटेल में इसलिए पढ़ा है अपन ने क्योंकि कोविड की वजह से पढ़ा है, अदरवाइज वी जनरली यूपीएससी डजंट गो इनटू दैट मच डिटेल एंड यूपीएससी डजंट आस्क क्वेश्चंस इन इतना टेक्निकलिटीज. बट जब ये पूछा गया था हमने पढ़ा रखा था बिकॉज दैट ईयर वाज ऑल अबाउट कोविड ओनली. 2020-21 was all about COVID. Okay, now in the context of hereditary disease, consider the following statements. Passing on mitochondrial disease from parent to child can be prevented by mitochondrial replacement therapy either before or after in vitro fertilization of eggs. True or false? Passing on mitochondrial replacement therapy, हाँ, वो हो जाएगा तो माइटोकॉन्ड्रिया रिप्लेस हो जाएंगे, ठीक है। अ चाइल्ड इनहेरिट्स माइटोकॉन्ड्रियल डिसीजेस एंटायरली फ्रॉम मदर एंड नॉट फ्रॉम फादर। मदर से ही आता है माइटोकॉन्ड्रियल, ठीक है। सी 25 में सी। ओके, लेट्स गो टू 26। 26, consider the following statements in respect of probiotics. Actually, I'll make you write a lot of things about probiotics here, but before that, based on knowledge that we have, let us try to attempt it. And I'll make you learn a lot of things, but समझते हैं. Question number 15, sorry, which is 26. Probiotics are made up of both bacteria and yeast. इसमें ना ऐसे डाउट हो सकता है कि हमने तो probiotics का मतलब बैक्टीरिया, गुड बैक्टीरिया पढ़ा है, तो you may have doubt. Wait, let's go to second statement. Organisms in probiotics are found in food we ingest, but they do not naturally occur in our gut. Do they not occur in our gut? They are there. है ना, हमें जब उन्हें बढ़ाना होता है, then we take it from outside. They naturally occur in our gut. तो 2 for sure is wrong. When 2 is wrong, A and C are left. मतलब बस statement 3 आना चाहिए. 1 we don't care. Right? तो ना through this what are we learning? Never be frightened. जितना आता है we will use that knowledge. और अगर कुछ नहीं भी आता फिर भी we have 2 options, हम एक तो चूज करके आएंगे भगवान का नाम लेके. Probiotics help in digestion of milk sugar. अबे किससे सब में गुड बैक्टीरिया इज हेल्पिंग अस इन डाइजेशन. व्हाई वुड इट नॉट हेल्प अस इन डाइजेशन ऑफ मिल्क शुगर? थोड़ा बहुत रोल तो कहीं ना कहीं करेगा ही, है ना. तो 3 शुड बी करेक्ट, तो आंसर शुड बी सी, है ना. लेट्स राइट डाउन सम थिंग्स अबाउट, यहाँ पे आंसर इज सी. इवन विदाउट नोइंग मच अबाउट प्रोबायोटिक्स वी हैव बीन एबल टू मार्क आंसर एज सी. बट अभी हम पढ़ लेते हैं प्रोबायोटिक्स के बारे में. वी विल स्टडी मोर थिंग्स. लेट्स राइट डाउन सम थिंग्स अबाउट प्रोबायोटिक्स. Probiotics are live microorganisms. Probiotics are live microorganisms and have health benefits when consumed or applied to the body. When consumed or applied to the body. Or consumed or applied to the body. They may be found in yogurt, dahi, curd. They may be found in curd, other probiotic products. उसमें other probiotic products लिख लो, dietary supplements लिख लो. Curd, dietary supplements and beauty products. अप्लाई भी कर सकते बेटा. एंड ब्यूटी प्रोडक्ट्स. डेफिनेशन में बोला ना, दे कैन बी कंज्यूम्ड और अप्लाइड. अप्लाई क्या करोगे? ब्यूटी प्रोडक्ट्स. ब्यूटी प्रोडक्ट्स में हैव गुड बैक्टीरिया. ब्यूटी प्रोडक्ट्स में हैव प्रोबायोटिक्स. They contain a variety of microorganisms, including bacteria and yeast. Including bacteria and yeasts. They contain a variety of microorganisms, including bacteria and yeast. बैक्टीरिया, जैसे गुड बैक्टीरिया में एक एग्जांपल है लैक्टोबैसिलस. This is one of the good bacteria there. Lactobacillus. या एक और होता है बिफिडोबैक्टीरियम. These are examples of good bacteria. These are examples of good bacteria. ओके. फिर ईस्ट का एक एग्जांपल लिख लो. These are good बैक्टीरिया के एग्जांपल है. प्रोबायोटिक बैक्टीरिया के एग्जांपल है. हमने बोला बैक्टीरिया में प्रोबायोटिक्स में देयर कैन बी बैक्टीरिया, देयर कैन बी यीस्ट, देयर कैन बी अदर माइक्रो ऑर्गेनिजम्स आल्सो, है ना. These are some examples of प्रोबायोटिक बैक्टीरियास। एक ईस्ट का एग्जांपल लिख लो। माइसिस, अरे सैकरोमाइसिस बोलार्डी, BOULARDII। CASHAROMYCES BOULARDII। ये बस इसलिए लिखवा रहे ना कि ईस्ट भी है, तो एक एग्जांपल रहना तो ना you'll remember कि प्रोबायोटिक्स में also include yeast. Probiotic is not just consumed, it can be applied. Probiotics can therefore be in beauty products. आपने कई बार सुना होगा लोग दही लगाते हैं चेहरे पे, कहीं भी लगा लो यार, जहां मन करे लगाओ, चेहरे पे नहीं लगाते दही। तुम्हें क्यों दिखाएगा कोई। चलो, सॉरी, मेक्स प्रोबायोटिक समझ में आया, इतना ही जानना है, ज्यादा नहीं। यू विल बी एबल टू सॉल्व ऑल द क्वेश्चंस। अब लेट्स डू द लास्ट वन, वुल्बैकिया मेथड, controlling viral disease spread by mosquitoes, right? For A, simple, easy ones. So we are done with health. कल अपन मिलते हैं